Dr. Tejas, you can start.
Yes. Am I audible, everyone? Audible है sir?
हो हो ऑडिबल आहे.
Okay, okay. ठीक है. Hello, good afternoon all. Myself Vaidya Tejasvi Pippalgaonkar, Mass PG scholar, Navi Mumbai. Today I warmly welcome you all the respected dignitaries, PG scholars, Ayurvedic practitioners, and students. So today is the 97th meeting, clinical meeting of MAS. So MAS काय आहे? So त्याचे एम्स मेनली असे असतात की टू डिस्कस चॅलेंजिंग क्लिनिकल केसेस फॉर टू इम्प्रूव्ह पेशंट आउटकम्स, to promote knowledge and exchange continuous learning among Ayurvedic practitioners, to provide a platform for member and to present it. So every monthly आपले meetings होते and MAS has been regularly organizing it since 2009 across all the districts of Maharashtra to create a strong academic ecosystem for Ayurvedic students. So today is the 97 meeting and on and onwards to the 100 milestone soon. So today's topic is infertility case series. This case series is very significant and sensitive topic for today with increased incidence cases in India. So it is necessary for us to understand this condition through Ayurvedic perspective. So today we are very privileged to have with us our esteemed speaker, respected Vaidya Seema Mehre ma'am, to guide us on today's topic. To begin with that, before that, I would like to invite our PG Mass coordinator, Vaidya Sankalp, to please explain the aims and objectives for Mass.
Mass aims and objectives. First, Ayurvedic Sanghatan. To achieve the objectives of MAS, we aim to include all the Ayurvedic students and doctors in the organization. Along with this, we will work in friendly and collaborative manner with other established Ayurvedic associations. Our global Our goal is to build a strong, unified, indestructible global organization of Ayurvedic professionals. Second, Ayurvedic Sarvabhaumatva, to establish a sovereignty of Ayurvedic physical to establish sovereignty of Ayurvedic physicians in administrative, private, educational, clinical, medico-legal, and public health sector, to ensure that the Ayurvedic doctors receive the same or even higher respect and prestigious positions as modern medical doctors, to establish Ayurveda as a primary and independent healthcare system. Third, medical education, to, to address gaps in medical education by organizing national and state level conference, workshops, and short term courses, to serve as an important link between universities, colleges, and students, to resolve issues in the academic system, to continuously strive for balanced curriculum including both classical and Ayurvedic modern science. Fourth, research, to participate in various fields of research, to provide a platform for Ayurvedic and non-Ayurvedic researchers who contribute to Ayurvedic science, to bring their research output to the awareness of common Ayurvedic students and practitioners. Fifth, social committee, to receive the spirit of service in medical field and actively provide healthcare to underprivileged and neglected communities, to support government agencies whenever needed, to offer medical services during medical calamity during natural calamities, pilgrimages, and emergencies to create awareness in society about preventive healthcare, Ayurvedic wellness, daily routine that is dinacharya, and seasonal regimens that is rutucharya, and encourage their practical implementation. Sixth, cultural activities to strengthen the organization and preserve our natural values and heritage by organizing cultural organizations such as annual gathering, Maharashtra Day, Mass Foundation, and contribution of celebration of great personalities. Seventh, promotion of Ayurveda to promote Ayurvedic principles, classical theories, health preservation, global welfare, and humanitarian values at all levels of worldwide. 8. Cooperative initiations to work towards the growth of Ayurvedic doctors through cooperative ventures to initiate projects such as new Ayurvedic hospitals, pharmaceutical units, Panchakarma equipment manufacturing, and similar enterprises. Ninth, Ayurvedic Vanaspati Samvardhan to work towards the conservation of Ayurvedic medical plants to coordinate between medical plant growers, farmers, pharma companies, distributors, government bodies, and botanists to develop effective strategies. 10. Rashtriyavad while working for Ayurveda and to enthusiastically contributing to the nation's welfare and progress whenever opportunity arises, to always uphold and promote the spirit of true Indian nationalism. Thank you. Jai Mas, Jai Ayurveda.
Thank you so much, Dr. Sankalp. Now, as far as Ayurvedic traditions, every auspicious event begins with worship of Lord Dhanvantari, the divine originator of Ayurveda. For the chanting of Sri Dhanvantari Stavan, I invite our Mass PG President, Dr. Seema Mehre ma'am, to please recite the Dhanvantari Stavan.
नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जराऋतुभयमृत्युनाशनं दातारमीशं विदंशदीनां शङ्खं चक्रं जलोकाम् ददतं घृतघटं चारुदुर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यां शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं तटितटिविलसश्चारुपीताम्बराढ्यं वन्दे धन्वन्तरीतं निखिलगदवं प्रौढदावाग्निलीलं Lodadava
Thank you so much, ma'am. Now, to formally introduce our speaker for the day, I kindly invite Dr. Archana Bhaviskar, our PG coordinator, to please introduce to the speaker for the day.
Good afternoon, everyone. It's my honor to introduce highly respected Dr. Seema Mehre ma'am, Professor and HOD of Prasuti Tantra and Stri Rog at YMT Ayurvedic Medical College, Kharghar. Dr. Mehre ma'am is completed her MD in Stri Rog and Prasuti Tantra from Tirak Ayurvedic Mahavidyalaya, Pune. After completing BMS, BA Sanskrit and Diploma in Yoga and Ayurveda, she is a PG guide, PhD guide, and mentor for fellowship in women's and mental health care management. Ma'am is currently member of Research Advisor Committee at Sion Ayurvedic College for PhD study since 2021. Ma'am clinical expertise including Ayurvedic gynecology, especially PCOD, infertility management, and Supraja Garbha Sanskar, integrating music therapy in pregnancy. Ma'am has conducted more than 623 laparoscopy TL procedure. Ma'am has conducted significant clinical trial including studies on Shatapushpa in PCOD, Kashyapakta Shishupakta remain an unovulatory cycle under MUSH LTRG and several pharmaceutical research projects. Ma'am has 23 research publications, present 14 papers, and chair multiple scientific sessions, including Kashyapi 226 and KAGOF Kolhapur. Dr. Mehre ma'am has been active member and treasurer Family Planning Association of India, receiving the Best Volunteer Award in 2018 as her contributing since 2000. Ma'am continues to guide numerous students and conduct seminar, webinar, and Garbha Sanskar program. A multifaceted personality, ma'am is also gifted in painting, singing, drama, and was awarded the Best Outgoing Student of Tirak Ayurvedic College in 1989. Dr. Mere Ma'am is not only a respected teacher and researcher but also a compassionate clinician who has touching thousands of lives throughout her expertise in Ayurvedic women health, infertility management, and Garbha Sanskar. We are truly privileged to have her among us today. Please join me in warmly welcoming Dr. Seema Mehre ma'am. Ma'am, it's honors to inviting you to guide us with your rich knowledge and experience. Thank you, ma'am.
Thank you so much, Dr. Archana, for the wonderful introduction. And without any ado, we'll begin for our lecture today. So I request our respected speaker for the day, respected Vaidya Seema Mehre ma'am, to begin with today's lecture.
कुठं गेलंय ते मॅडम पिपडी दिसते का हॅलो मॅम
I guess doctor is on mute.
Hello.
हा
Am
मॅडम
I audible?
येस
Ah,
मॅम येस मॅम
Yes,
yes,
ma'am,
yes,
you're audible.
exactly. I was just wondering what's going on. Okay, then good afternoon to all of you. First of all, many thanks for MAASD for inviting me for this beautiful your program and session. And special thanks to Ramdas Darje, sir. We all know him very well. One of our famous ex-students of IMT college. And I'm feeling very nice and privileged to be here today. Today we will be talking about infertility case series in the sense that we will begin with the theory, but afterwards we will talk about practical tips or practical things which we did in such cases, and that is what I think today we should do. Even if there are 5 cases or 7 cases, the whole idea is how to treat such cases if they come to you in your private practice. So many of them are students, many of them are practitioners who are interested in treating infertility. So this is my attempt to educate everyone in my जेवढं मला जमेल तेवढं मी करतेय. So we will begin with this. Next slide. So first we will begin with the basics. First 20 minutes we will be talking about the theory about infertility. So inability to conceive after 12 months of having regular unprotected coitus. That is the main thing. Some 10-15 years ago, this was around 2 years. But now the time limit has come down to 1 year, because there are many other reasons like people get married late, so they are already ovulating and already trying also. So they are in such age that the fecundity is good. That is why they can conceive. That is why nowadays it has come down to 1 year. So inability to conceive after 12 months of having regular unprotected coitus is infertility. Next slide. So there are two types, primary and secondary. Primary infertility, the patient has never conceived within months. And secondary infertility, the woman has been previously pregnant, regardless of the outcome, and now she is unable to conceive. Next slide. So factors affecting fertility, they are the frequency of intercourse. Coital frequency is positively correlated with pregnancy rates. Probability of conception is frequency of the intercourse. 1 time per week, 17%. 3 times per week, 50%. Here only I will explain what is fecundity. Fecundity means the ability of the uterus to capture the sperm and fertilize the egg immediately, in that sense. So many times you used to see that, especially in some olden days, like even in 10, 15 years ago, in such cases we used to see that immediately after marriage they get only one LMP. और LMP के बाद marriage हुआ and immediately the patient got conceived. So बारसं आणि लग्नाची anniversary ही एकत्रच यायची, असं खूपदा दिसायचं पूर्वी. So that is known as fecundity. That is the ability of a woman to immediately conceive. How soon she conceives after having the first intercourse. So that is how coitus and fertility is related. Next is the timing of the intercourse. It should be just before ovulation. That we all tell nowadays. Even at GP level also, so many my own students I see practicing infertility. So this knowledge is very common. STIs and other infections. Now this is gonorrhea, chlamydia. In women, it is PID, pelvic inflammatory disease, which is a big cause of tubal infertility or tubal block. In men, it is urethritis, epididymitis, axillary gland infection, mumps, leading to orchitis. This may cause secondary testicular atrophy. आपण नेहमी इतिहास घेताना पेशंटचा पुरुषांच्या बाबतीत विचारायला लागतं, लहानपणी गोवर झाला होता का. मोस्ट ऑफ देम डोंट रिमेंबर बिकॉज दे वर व्हेरी स्मॉल, बट दे हॅव टू आस्क देअर पेरेंट्स की मला काही गोवर काढण्या वगैरे असं खूप सिव्हिअर झालं होतं का, बिकॉज दॅट अफेक्ट्स द testes and that causes a testicular atrophy which has to be treated. Then there are other infections that must affect the fertility. They are tuberculosis, then toxoplasmosis, malaria, schistosomiasis, and leprosy. These are something, these are infections which are waterborne, and most of the time, okay, I just got a message that no Marathi is understood, so it's okay. I will, if at all I feel, I will converse in Hindi in between. So these infections are mostly waterborne infections and mostly associated with poor hygiene. And all of these basically they cause this genital organ dysfunction. So either they will infect the patient, either they will infect the genital area in such a way that the receptivity in females, the receptivity of the endometrium is reduced, and in males you can see the scrotum or other areas getting infected. Next slide. So how do you evaluate fertility? That is a general history, sexual history, reproductive history, gynecological history, age at menarche, menstrual periods, duration and interval, previous contraception, previous testing and treatment for infertility. Next slide. The treatment possibilities in the female, what we do is if there is ovulation, this I am talking of allopathic science. Ovulation disorders, we give ovulation inducing drugs. Hypopractinemia, prolactinemia, prolactin suppressing drugs. Uterine and tubal abnormalities, surgical procedures. Cervical mucus problems, intrauterine insemination. Endometriosis, suppressing hormones or surgical procedure. Next slide. So treatment of female infertility, these are the ovulation induction agents which are common at present. We should know all this because basically even if you are a specialized a person working only in Ayurveda, patients come with these reports. So you should be able to interpret these reports, or you should be able to interpret in such a way that you can interfere with your own. Many times what happens is we are doing diagnosis by allopathy and treating by Ayurveda. And the reason for this is patients come with this files, list of files, list of old doctors. So you should be able to identify those terms. That is why we have to talk about this. So clomiphene citrate, it induces release of gonadotropins. Gonadotropin releasing hormone analogs means drugs which are similar to this. They are similar to the natural GnRH, and these produce a massive release of GnRH into the circulation. Third is gonadotropin itself. These are human menopausal gonadotropin. In menopause, HMG, this contains equal quantities of FSH and LH because we know we need the function of both. Then there is bromocriptine, which is very old drug actually, even before the cabergoline. It suppresses the production of prolactin. Next slide. So treatment of female infertility. First is IUI, the fertility procedure in which sperms are washed, concentrated and injected directly in the woman's uterus. This procedure we do in our college also. Then ART, that is assisted reproductive technology. Non-coital methods of conception include all fertility treatments in which both the eggs and the sperms are manipulated. So types of ART are in vitro fertilization, IVF, zygote transfer, that is ZIFT and GIFT. Next slide. Treatment possibilities in the male, surgical treatment in some cases, for example, varicocele. Then in such cases, once you should consult a surgeon or the urologist because all varicocele do not produce infertility, cause infertility. There are grades in that, and the decision has to be taken with a justified decision should be there for the operation. Second is IUI, which will be performed either with the patient's or the donor's sperm. ART procedures in the male are GIFT, IVF, ICSI. This is intracytoplasmic sperm injection, in which the sperm is manipulated and it is selected. Only one sperm is selected, and the the ripe ovum is injected with it. The G procedure usually, otherwise the sperm has to do it himself. That sperm is weak. So in which patients this will be beneficial? It will be beneficial in patients who are having low sperm count or low motility, less rigor, rigorosity of the sperm. So the sperm, जो काम उसको खुद को करना चाहिए उस sperm को, this is done by the injection. It is a micro procedure. Donor semen should be free of STDs and HIV. That is obvious. Next slide. So this is about, in short, I spoke about the allopathic part. We will go with to the Ayurvedic part, and afterwards I will start explaining my cases, because with each case I will be explaining again the Ayurvedic part. So that is why I will do this in short. Next slide. So this is the definition of Vandyatva in the books of the Amar Kosh and Shabda Kosh. Vandyatva means basically the patient or the Sri. They are talking of the Sri Vandyatva first. So the woman does not bear any children. That is the basic. So Garbham Upahanti, Vandhya Vedat Garbha Upadhatini, Vihanti Garbham, Amar Kosh, Vandhya Nirapatya Sri Shabda Kosh, यदा ही अस्या शोणिताख्य बीजे गर्भाशयस्य निर्वर्तके बीजम प्रतिष्यति तदा वंध्या जनयति अष्टांग संग्रह शारीर स्थान वंध्या नष्टार्थवम विद्या सुश्रुत. And Bhela Samhita has also explained in the same manner that yoni doshena means yoni doshane. Because of the yoni dosh, the garbha doesn't stay in the garbhashay, and that is why she has Vandati. Next slide. So these are the types explained by all the Granthakara. First is the Haritokta Bhed, which is Haritokta Vandhya. All students of, even if they are UG students, they know how is Vandhyatva treated. And Hari was the first person. In fact, he is the only person who has explained 6 types of वंध्यत्व. ऐसा नहीं है कि बाकी लोगों ने बोला नहीं है, लेकिन the references come indirectly. जैसे कि चरक ने योनि व्यापद बोले हैं, but during योनि व्यापद the ultimate result of any yoni vyapad is vandhyatva. Whether it is Rajaska, whether it is Asuruja, or whichever yoni vyapad you choose, the end is that only, always. The same thing happens in yoni dosh, in Artha vyapad, in Rajodushti, you name it, the ultimate result is vandhyatva. So these are the indirect references, but direct explanation was given by Harit, and that is a very shall I say सर्वव्यापक जिसे बोलते हैं ऐसा एक्सप्लेनेशन है. सो उन्होंने 6 टाइप्स बोले हैं. मोस्ट ऑफ द टाइप्स कम इन दैट. गर्भकोश भंगा मीन्स अगर किसी को कुछ इंजरी हो गई बचपन में या व्हाटएवर, or even we can say Asherman syndrome where repeated DNCs are done and there is a injury to the endometrium and because of that adhesions are formed. So any type of injury to the kshetra that causes garbhakosha bhanga and because of that there is infertility. Then next is Kakavandya. Kakavandya is one time fertility, right? She gets conceived only once. After that, she doesn't conceive again. So this the name why this name is given उसका explanation दिया है. There is one thought that ऐसा बोलते थे. We don't know the truth. लेकिन ऐसा बोलते हैं कि कौवे को सिर्फ एक आँख रहती है. There is only one eye. I don't know, but that is why he twists his head. He never sees straight. He's always twisting bending his head, the crow. So we don't know. I haven't gone to see it, but this is what there is a myth that because of this जैसे कौवे को एक ही आँख रहती है वैसे काकवंध्या में सिर्फ एक ही आँख रहती है, एक ही बच्चा रहता है. Then anapatya means जिसको once also she has not conceived. गर्भस्रावी means the POI, bad obstetric history. So she conceives, but she goes on and on repeating abortions. Then Mrutavatsa means stillbirth. Means the baby is conceived till 9 months also it goes, but then there is intrauterine fetal death, or sometimes stillborn, like even there till the delivery process it goes, but by the time it comes out it is dead. So, then there is Balakshay. Balakshay means the emaciation or any type of severe anemia, HIV, tuberculosis, the diseases which are causing severe emaciation in the patient. For example, in Arajaska Yoni Vyapad, you can see that the Brusham Kare, the main explanation of Arajaska is that the patient does not get menses only. And why she doesn't get menses? Because there is no Rasadhatu only in a body. Even if it is there, there is so much avrodh created by the emaciation. That is why we have to treat the patient first and then the uterus. This is what Balakshay means. In Charakokta Bhed, there are Apraja, Sapraja and Vandya. Apraja means patient has not conceived even once. Sapraja means again the same thing, secondary infertility. And Vandya is total sterility. She will not conceive even once in her life. Madhav Nidan has explained 13 types. They are according to doshas, hetus, adhivamshaja, doshaja, bhutaja, daivaja. So basically all of them are saying the same thing. Garbhasravi again he has mentioned Mruta Putrika, which means the same again. Yet still births are there. Kanya Prasutya means what? Sometimes, पहले बाल विवाह बहुत थे. So patient is to get only one menses and she is to conceive. So you can see that girl is a child herself and she is getting conceived again in the same period. She herself is 13, 14 and immediately she gets conceived. So this early pregnancy causes a small type of injury to the uterus which can lead to physiological reactions causing infertility afterwards to the patient. Next slide. So Garbha Sambhav Samagri we will talk in short. Rutu Kshetra, Ambu and Beach. Rutu means the ovulation period or the right time, ripe ovum or ripe season. Then Kshetra is the area. In the female it is the Garbhashay, in the male it is the Andashay or the male reproductive system. Ambu means you can say in Ayurveda we can talk about the ahara ras or the one which goes to the fetus, one which goes to the ahara rasa tridha vipadyate. We can say those. Ambu means those rasa vahinis which are directly connected to the fetus. But in allopathy we can compare it to the hormones which are supporting the pregnancy. And bees again here it is not only the male the sperm but it is about the ovum also. Next slide. So this is the nidan which we have thought. I have thought after so many years of practice that basically if you go to see uh, everything starts with the नित्य आहार लिया आपला इन आवर योनिका शोक भी उन्होंने बोला है मिथ्या आहार विहार एंड प्रदुष्टेन अर्थवेन च जायन्ते बीज दोषाच्च दैवाच्च शृणुतः पृथक् means what everything is starting with the mithya ahar vihar. Nowadays what we are seeing आजू बाजू में जो देख रहे हैं पीसीओडी थायराइड डायबिटीज यू नेम इट यू हैव इट ओबेसिटी everything bp everything is related to the lifestyle and lifestyle means mithya ahar. So the basic is your start, the nidan is there, matlab the hetu is there. So hetu sevan ke baad first thing is what is happening is the three dosha are affected, either vat, pitta or kapha. Along with them, next comes the dhatu, rasa, rakta, मांसम, मेद, रसात, रक्तम, रक्तात, मांसम. ऐसा करके करके तीन तीन दिन से वो प्रोड्यूस होता है ना आगे जाके. So ultimately it is going to affect what? The shukra and the artha, and that is going to create infertility. So this is the way how the samprapti goes. All this cause and basically we all know सगळ्यांनी सबने ये पढ़ा है पहले से ही रोगा मंदेग्नो है ना रोगा सर्वे अपनी मंदेगी. So manda agni is the basic reason. If you take the history of the patient, either her agni is manda or it is vikrut. आप देख लो अभी इस लेक्चर के बाद whoever are practicing, whenever your next patient comes, you think about the Agni. And then you will, most of the people will realize they must be already doing it also. But this is what I have observed. So from the Agni, then comes, other Agni mante hai, so next comes Samata. Samata, it causes Avru. And that Srotoroj is going to cause the infertility. Here there is a combination of Vata and Pitta, Vata and Kapha. How it goes, how Rasadushti goes, how Raktadushti happens. It leads to Artavadushti. Then again, Poshanatmak Vikruti means even if the baby is there in the womb, पोषण ही नहीं होता है इसलिए फिर बच्चा नहीं होता. So this is the ultimate संप्राप्ति of वंध्यत्व. Next slide. Management in Ayurveda, we all have been doing this since years. Now also we are doing the same thing. Nidana Parivarjan first. अग्नि दीपन रसायन बल्ले धातु पोषक औषधियाँ मुख्य रूप से काम करती है. प्रजास्थापक गण त्रिदोष शामक चिकित्सा निदान परिवर्जन योनि व्यापक चिकित्सा जैसे जो दोष आता है सामने वैसे हम ट्रीट करते जाते हैं. एंड पंचकर्म वी ऑल नो हाउ पंचकर्म हेल्प स्पेशली इन आयुर्वेदा इन स्पेशली इन इनफर्टिलिटी. सब सब वायु से सबसे इम्पोर्टेंट ज्यादा है अपान वायु. एंड along with that there is the other vayus also who are which play a very important role in this. But अपान वायु का कार्य सबको मालूम है. अपानो अपन अगाह that श्लोक everyone knows. In that also गर्भ गृह्णाति धारयन्ति and मुञ्चयति. शुक्र शोणित संसर्ग विसर्गः means whatever the male and the female physiological hormones and everything is there, उसका सब हेल्थ रखना. प्लस गर्भम गृह्णाति एक बार गर्भ फॉर्म हो जाए उसका ग्रहण करना. धारयन्ति and मुञ्चयति. So धारयन्ति means till 9 months it has to protect and after that मुञ्चयति. Saman, just 1 minute before I said कि Saman acts on the Agni because Agni is very important. And then Udan also is very important because if you have observed hypothyroidism जिसे बोलते हैं हम उसमें उत्साह बल वर्ण that comes down. And उदान का मेन कार्य वो है प्राण एंड उदान. So next time when you see a hypothyroid patient, try to just see if you can give see these points in that patient. So we can treat them accordingly. Next slide. So these are the various formulations which we see in the Samhitas. Dhruva Shatavari Churnagar, Kashmaryadi Grita, Phala Grita, Phala Kalyanaka Grita, Sita Kalyanaka Grita, Priyangadi Taila. So many, you name it, you have it. There are हजारों lakhs में और millions में productions है हमारे ग्रंथकारों ने जो दिए हैं. We just have to open the books and start working on them. Next slide. So this is the management which we have zeroed down in our college. This is what we work on. Annuity cycle, if there is an annuity cycle, we work on them by work on it by Chandra Prabhavati, Yogaraj Gupta, Ashoka Rishta, Dashamula Rishta, PCOS, Kanchanar Buggu, Arogya Vardhini, Punarnama Buggu, and our very own Shatapushpa regimen. I will talk about it when I come to the case. Next slide. So, an ovulation, we are using Pushpa Dhanvaras, Shatavari Ashwagandha, Mahanarayan tail, as explained in Rasataranjini. LH unruptured follicle, Chitrakadi Vati 2 tablet PDS. In my experience, what I do sometimes ovulation study chalu rehta hai. Sometimes the patient is on injections also, but still the follicle doesn't get ruptured. Okay, but in such cases, I give the patient Sahachar Tel Matra Basti, and the next day we see it is ruptured. So this we have seen in our college, which I am going to tell you in due course. Next slide. So this is the tubal factor. To remove the tubal block, we use Kara tail, then Lashun tail, Dhanvantari tail. I had just gone to Pune for a conference recently, and there I saw this Kidra Kumari oil, which is now they are saying this is the next thing next to Charatel. So I have to still use it. If anyone is already using it, please let me know how are the results. As per my knowledge, but it is very expensive. So we have to think about those things also. This is a diagrammatic representation of the tubal block, and this is the HSG showing how the tubal block looks. Next slide. Low AMH is one more thing which we are coming in contact with daily practice. So basically from our side what we are giving Ayurveda is Balyan Bruhan Chikitsa, Rasayan Shatavari Churna, Bhogvita, Ashwagandha Kshirapa and other such things. So in this there is one mode of thinking that actually we see matter is neither created nor destroyed. Ayurveda is not a miracle. It is not अंधश्रद्धा कि कुछ भी दे दो और ये दिया और मेरा ये हो गया. If it is in mathematics, we have to speak in mathematic terms only. But the thing is, even if the image is low, whatever remaining over are there in her body, that we can use. That उसका बल हम बढ़ा सकते हैं. That is the only thing we can do. This is one example which I always give to my students also. That suppose you are having आपका bankruptcy हो गया है लेकिन सिर्फ 5,000 रुपए बाकी है बैंक में. उसका तो कुछ हो ही नहीं सकता है. यू आर इन टोटल लॉस. लेकिन उस 5,000 से आप कुछ तो और कर सकते हैं जिससे आप छोटा कुछ नहीं तो some business, very basic home business you can start or something. How you utilize those 5,000 rupees is up to you. So that in the same manner, this is a very loose example, vague example, but still in the same manner, जो कुछ भी बचा कुचा है उसके लाइफ में और इसके रिजर्वायर में, that we can put to good use and we have seen the results. In PCOD, so many patients actually PCOD में AMH बढ़ता है, but that is विकृत बढ़ना, that is not प्राकृतिक. Next slide. So this is we will talk about endometrial thickness also. उस पर भी हम काम करते हैं हमारे drugs. How we have to see the endometrial thickness? When you see the reports, sonography reports, see these three lines. They are the triluminar appearance of the uterus, and this is around 10 to 12 millimeter. अगर इससे कम, if it is less than 5 millimeter, then she is in deficit. Sometimes it is bile endometrium also. So for this what we are using, the basic concept is प्रीनन करना. जैसे हम एक जमीन को भिगोते हैं ना, जमीन है जिसको हम ऋतु क्षेत्र अम्बु बीज में हम एग्जांपल देते हैं ना फार्मिंग का. तो उसमें जब हम खेती करते हैं, फार्मिंग करते हैं, तो वो वी हैव टू प्रिपेयर द सॉइल शुड बी फर्टाइल. तो उसके लिए जो हम भिगोते हैं उस जमीन को, व्हाट वी आर डूइंग, वी आर डूइंग प्रीणन, है ना. वी आर इंक्रीजिंग द रस कंटेंट ऑफ द सॉइल. सिमिलरली यहाँ भी एंडोमेट्रियम का प्रीणन कर रहे हैं हम. किससे कर रहे हैं? दाढ़ीमादी घृत, कल्याणक घृत, सुकुमार घृत, फलघृत and महातिक्त. These are some examples. There are many, but this is what we use in practice. Next. So for psychological aspects, we have Saraswata Rishta, Mukta Pishti, Manasmitra Vatta, Shirodhara, and Surya Namaskar Yoga. Next slide. So the summary of till now, what I was talking of, I told you the first 20 minutes will be in this. So the summary is about Kshetra, Ambu and Beach. So Shodhan, uh, in this case, we have to, how we are going to treat the counseling of the patient. Pitta Shamak drugs are given, Shodhan is done. Then Basti, medicated ghee, oil, etc. Shodhan, Rasayan, Balya, Dhatu Poshak drugs, and Shodhan, Swastha Vrutta, Dinacharya, and Ritucharya. So this is the way, in short, we treat the patient. Next slide. So now we will start with the cases, and with each case I will explain how and why this this medicine has worked. The patient has come. Yoga slide, just I can show only the last part. Just show the last slide. Someone is asking for that slide. No, not that. Before that. हाँ, so इसमें तो सिर्फ पश्चिमोत्तासन बताया है. 1 minute. They want to see the yoga slide. No, no. हाँ, this one. So this is Surya Namaskar. I tell all my PCOD patients, I give them 10 asanas actually. Paschimottanasana is the most famous. That is why उसका मैंने diagram दिया है यहाँ पर. But there are other Sukhasan, Parvatasan, Vajrasan, Talasana, then Pavan Muktasan, then Gomukhasan. So there is a list of 10 asanas which I tell. And plus Surya Namaskar, minimum 10 to 15 times. That उससे belly fat भी कम होता है and PCOD में भी वो help करता है. Next slide. Yeah, case number 1. Next slide. So this patient came to me with primary infertility, married since 3 years. He had a history of PCOS. It was already treated elsewhere. He had done DNC biopsy and diagnostic laparoscopy with PCOD drilling were also done, followed by IUI. जैसे हम सबको experience है, people do everything and then come to us. Actually, the scene is changing now, which I'll tell you later about another case who came immediately to me. So in this case, he had done everything. एक साल राह देखी उन्होंने कि कुछ होएगा, कुछ हुआ नहीं. तो ultimately on 27th August 2018, she came to us. Complaints and history was irregular menses and pain in abdomen. Menstrual history was 3 days with a 50 to 60 days interval. तो रेगुलर तो आ ही नहीं रहा था उसको. Investigations done was CBC, blood group, BSL, fasting PP, serology, USG, routine and follicular study, hormonal assay, husband semen analysis, pap smear, TB PCR, and HSG and AMH. Next slide. General examination was normal. Local examination showed mild erosion, mild white discharge. Uterus was RV area. It was normal size. Fornices were non-tender. Next. This showed normal size. This is about sonography. Sonography was showing PCOD changes, and HSG showed right femoral block and left corner block. Hormonal profile showed raised LH, low FSH, which is a characteristic sign of PCOS. Then ovulation study showed ovulatory cycle. Semen analysis was good. It was 86 per million, 86 million. Rest was normal. Next slide. So we started her on Shatapushpa regimen. And along with this, it was not only Shatapushpa. In the beginning, I gave her, along with that, I gave her Panchakarma, Yog Basti, Matra Basti, Uttar Basti. Shatapushpa regimen means, I'll explain in next slide. But along with that, these medicines, Chandraprabha, Dynama, Allos compound, Gokshuradi Gugu, tablet Leptadin, liquid Cital, जैसे सिम्टोपैथिक भी उसको देना पड़ा, बीच बीच में वो आती थी यूटीआई है तो सिटाल दे दो या सिरप नीरी दे दो, है ना. तो समटाइम्स वी हैव टू ट्रीट विद symptoms also. So her treatment was started on August 18, but she conceived in May 19. So around 7 to 8 months she needed. Next slide. So Yog Basti, Anuvasan Basti with Tiratel and Niruha Basti with Dashamul Kana, Yatyasat Pramana, Uttar Basti, Char Tel and Palagrita, Matra Basti of Sahachar Tel. Next slide. So this is about Shatapushpa now. These are the dill seeds, बाड़न शेपा जिसे कहते हैं हिंदी में या मराठी में. Soma, Anathem soma. Anathem graveolens is the real name. Next slide. So these are the shlokas. If you are still having your Kashyap Samhita with you, you can even buy it now also because it is very helpful in many cases. So there is page number 181. इसमें शतावरी शतपुष्पा अध्याय दिया है और यहाँ से श्लोक ये अध्याय शुरू होता है. दिस इज नोन एज Kashyapukta regimen. I have worked on this as a research project in the MUHS and we received a 1 lakh grant for this project and we submitted it and it is one of our best research projects till date. So Shatapushpa has to be taken. Uh, Before that, I will just let you know what is the Shatapushpa regimen and where it is come. Now the Shatavari Shatapushpa अध्याय में उन्होंने क्या बोला है? These are the आर्तव्यापक. आर्तव्यापक पर सेपरेट अध्याय देने वाला सिर्फ काश्यप है, बाकी कोई नहीं. सबने आर्तव दृष्टि, आर्तव व्यापक, रजो दृष्टि, रजो ऐसा बोला है, लेकिन आर्तव व्यापक का मतलब क्या है ऐसा एक्सप्रेसिव एक्सप्लेनेशन जैसे हरित ने वंदत्व का बोला है, वैसे काश्यप संहिता इज फेमस फॉर दिस. So this shloka you can see artavam yana पश्यन्ति विफलम च यहाँ अति प्रभुतम अत्यल्पम अतिक्रांतम अनागतम अकर्मण्यमेव अमिश्रंस किंजात मृतयश्च दुर्बला दुर्बला दृढपुत्राश्च पुरुषाश्च वपुषा अथया प्रस्कंदना विवर्णाश्च याश्च प्रचुर्म मूर्तयः स्पर्शं च या न विन्दन्ति याश्च स्युः शुष्कयोनयः शतपुष्पा शतवीर्यो स्यातां तत्र अमृतं यथा पुमनपि उपयुञ्जानो यथोक्तेन अनुमते गुणम्. Next slide. So the translation is a woman who does not get menstruation or who gets it but it is not fruitful. One who gets it excessive and one our class can be it is delayed or sometimes does not get at all. The discharge is almost nil, just spotting. One who gets very early abortions, one whose vagina is dry and numb. She may be lean or obese. For these women, Shatapushpa and Shatavari are like nectar. An infertile woman or even a Shandi can conceive with Shatapushpa. This now regarding this sentence, I am going to talk at the end of my PPT. Please bear with me. We had a funny incident recently. Actually, the name itself suggests fertility boosting properties. It can be used in men also. So my next project is actually for Shatapushpa for men, and we are submitting it now. They're very just in time now. Next slide. So this is the Guna Dharma of Shatapushpa. Chita Kashaya Madhura Snigdha Vrushya Rasayani Vata विबंधग्नि वर्णो च उबल वर्ण वर्ण उजा बलवर्धिनी स्मृतिम मेघामती करी पथ्या पुष्प प्रजा करी धूतकल्पम I cannot read this 1 minute. Shatavirya Shatavar. Anyway, the explanation is this, that it is very Patyakarat, Shita Kashaya Madhuram, Snigdha Vrusha Rasayani. The words are self-explanatory. Next. Shatava, Pushpava, Goshavati, Chatra, Mishreya. These are some other words in English. In Indian languages, it is Indian Dilsi. Next slide. So this is Anatem graveolens, as I said before. It is not Anatem sova म्हणजे बडीशेप. Anatem graveolens means पाळणशेप. So कटु तिक्त, कटु उष्ण, तीक्ष्ण, वातग्न, कफग्न, ज्वरग्न, शूल प्रशमन, दुग्धवर्धक, पाचन, आस्थापन, अनुवासन, योनी विशोधन, शुक्र विशोधन, आर्तवकारी and पुत्रपरी. Name is Anatem graveolens. Next slide. So how you prepare, how you have to give the Shata Pushpa? This is a Sanskrit shlok. Chunitayaha palashatam nave bhande nidapayet tat churnam Shata Pushpayaha प्रातः उत्थाय जीर्णवान. म्हणजे पहले का खाना हजम होने के बाद प्रातः उत्थाय, सुबह पहले उठ के ब्राह्म मुहूर्त पे उठ के पलार्धम अर्धम च पलार्धम वा पलम वा सर्पिशा लिहे. तो शतपुष्पा को घी में भून के वो शक्त्याचे तस्य जीर्णांते भुंजित पयस औदनम. वो खाना है सुबह सुबह, और जब वो पचेगा उसके बाद ही खाना खाना है दूसरा. तो दैट इज वाई राइट. And based on this shloka, we prepare the Shatapushpa regimen. Next slide. So Prayoga Kala Vidhi is Shodhan, Shambhar Pal, early morning, rice and milk, and Panchakarma, that is Shatapushpa. So what the Granthas have given is, first you have to do the Shodhan of the patient, then early morning utke. So now we calculated this Palardham, Ardham, Va Palardham. We calculated it, and see, one pearl is 11.2 grams. So according to that, we have calculated, and we made three sections. One is 40 to 60 kg weight, then 60 to 80, and 80 to 100, 80 and above rather. So the basic first dose is 12 grams. First patients who are 40 kg to 60 kg, 12 grams हमने दिया था, and बीच के जो है उनको 24 grams, and the last 80 and above, they are supposed to take 48 grams. So since the patient cannot take so much Shatapushpa in the morning, how they can chew so much? So it is not possible. इसलिए in such cases we gave PD dose. But 12 ग्राम means 2 चम्मच होता है, 2 चम्मच और थोड़ा सा ऊपर. So that we prepare in our college only with in our own pharmacy. शतपुष्पा हम इसमें ये कर भूनते हैं, we fry in ghee, and powder is prepared, and that we have to give to the patient. At the first pangs of hunger, she has to eat oudan, म्हणजे rice and milk, and after that whole day she has to do what she wants. The only thing is she doesn't have to avoid junk food and all that we tell her. And पंचकर्मा भी जो बोला है वो शतपुष्पा का ही करो, ऐसे ग्रंथकारों ने बताया है. तो उसमें योग बस्ती हो या मात्रा बस्ती हो या नस्य हो, स्नेहन स्वेदन हो, जो करना है वो शतपुष्पा का ही करो. दैट इज व्हाट काश्यप हैज सेड. तो फिर उसका तेल का भी विधि दिया है, तेल कैसे बनाना है. उस हिसाब से हमने तेल भी बना के रखा है कॉलेज में, and for our project also we did. So we gave Matra Basti to the patient along with this Shatapushpa Churna, and we found fantastic results. Still we are giving it. It was so good that patients come and ask us that वो पाउडर दे दो, जिसको इसको दिया था उसको हो गया, अभी मुझे भी दे दो. नेक्स्ट स्लाइड. So method is as I said before, we have calculated the dose like this, and the patient is advised to chew the powder. Now since 10 grams, 12 grams is very difficult, ये ग्रंथों का dose है, so sometimes it is very difficult to tell. That is why we take in Round figures 20, 40, 60. Next slide. So this is a tale how it is prepared. Shatapushpa Palashatam Jala Doneshu Panchasu. This is the description. Next slide. Now, how Shatapushpa acts on this? So PCOS is basically a lifestyle disorder in which one of the reasons is cycle becoming very common. And Acharya Sushruta has also explained about Ubandha Uniapad when Ashtartava is mentioned. Okay, so we will talk about Shatapushpa regimen first. It includes the Churna and Panchakarma. The patient is supposed to chew this Churna with Koshna Jal in Rasayan Kal, preferably in Brahma Muhurta or Rasayan Kal. That is around at 5:30 a.m. Please don't shift the slides. Sir, now we are talking about the regimen. Please keep the slide. Don't change it unless I tell you. Thank you. So total period is about 6 months only, and that is given in the Grantha only. That gives अगर हीन dose देना है आपको lowest dose, so give it till 6 months. अगर अग्नि sir, please don't change the slide. Hello, please get the other slide back. बस. Now stop here only. No, इसके बाद का जो बोला है ना वो no, not this one. The next this one. Please stop here only. Don't change unless I tell you, please. Huh? Okay. So 5:30 a.m. को हमको उसको देना पड़ता है. At first hunger pang, she has to take rice with cow's milk, and the rice should be salt free. For patient compliance, sugar is allowed, but not. What is there? Is there any technical issue, sir? वो अपने आप स्लाइड्स आगे पीछे हो रहे हैं.
ऑटोमेटिक होते हैं मैम.
अच्छा ते
हाँ. आता ओके आहे का?
नाही. ज्या स्लाइडवर मी मी बोलत होते ती ही नाही. Now stop here.
ओके मॅम.
So total period is 6 months. After this, she has to follow sattvic diet and rules of general dinacharya and patya. She has to undergo panchakarma, which I had told you before. Now go to the next slide. So mode of action is Shatapushpa is an Ayurvedic herb, primarily works by regulating the menstrual cycle to phytoestrogenic properties, meaning that it can mimic the effects of estrogen in the body, helping to balance the hormonal fluctuations and improve ovulation, making it beneficial for conditions like irregular periods, scanty menstruation, Artavakshay, and infertility related to ovarian dysfunction. So basically, it acts on the SPO axis, hypothalamus pituitary ovarian axis. Next slide. So these are the reports of her hormones that patients have. I remember her name. She was Deepika Patil. Next. It was her HSG also. This is a case of PCOD with tubal block. She is having block as you can see. Next slide. This is the second plate. The spill is there but not on the left side. Patient के right side में थोड़ा सा spill है. Next. So this is the gravid uterus conceived after so much of Panchakarma and Shatapushpa regimen plus some other medicines like Dynova and Chandraprabha etc. Next. So now we will talk about the second case. This is about Asruja Vinyapat. Now this, of course, this diagnosis I did afterwards. Patient came to me first. She got treated. She got the baby also. And this was retrospect कि ये ऐसे हम इसमें लगा सकते हैं. The thinking was there, but the diagnosis about Asuja Univapor was after when her treatment was going on, it was in the back of my mind. That's what I'm trying to say. So this is these people have given me the testimonials with their name. That is why I am not hiding their names. See, this person came from Parel, and her first visit was in 2020. Last visit was in May. And she didn't come to me for a baby. Came to me with menorrhagia because in her present illness was irregular heavy menses since 2 years and no amount of hormones and सब देते थे उनको लेकिन वो ब्लीडिंग रुक ही नहीं रहा था उसका. She had one baby, LSCS, 8 years ago, and that cesarean because of failure of normal labor. Her menstrual history was that time it was normal. She started her menses at 13 only. Next slide. So in her past history, there was no history of contraception because she said ki every 15 days I am getting menses only. So I don't know when to keep relations, when not to keep, and I'm fed up about all this. So that is why she came to me for Ayurvedic treatment. Uh, she explained to me that she had a history of two incidences when she had delayed menses, but अगर यूपीटी करने जाती उससे पहले वो भीड़ हो जाती थी. So she had no idea whether she had conceived or not after her cesarean of 8 years child. Next slide. So then I compared it to Astruja Unigapar. उसमें ऐसा ही होता है कि पेशेंट्स कीप्स ऑन ब्लीडिंग एज इज सीन इन द श्लोक. रक्तपित्तकरे नार्यः रक्तं पित्तेन दूषितम् अतिप्रवर्तते यून्यां लब्धे गर्भेऽपि स असुरः. So she might have conceived also, but there was no proof. But the thing is, what I am trying to say, that with this thinking in my mind, I treated her as Adhoga Raktapitta and I got good results. And the side effect was that she got pregnant. तो फर्स्ट बेबी वाज अ मेल चाइल्ड. शी वैसे भी उसको चाहिए था बट बिकॉज ऑफ ऑल दिस शी वाज नॉट थिंकिंग ऑफ अ सेकंड चाइल्ड एंड शी वाज हैप्पी दैट द नेक्स्ट चाइल्ड वाज अ गर्ल चाइल्ड. तो उसकी फैमिली कंप्लीट हुई एंड शी वाज हैप्पी. द थिंग इज नेक्स्ट स्लाइड. नाउ हाउ दिस वर्क. माय मोड ऑफ एक्शन इज अधोकर रिक्त पित्त या कोई कुछ भी हो जहां जहां ब्लीडिंग है वहां वहां क्या क्या करना है ग्रंथकारों ने बताया है. आणि उसका चिकित्सा सूत्र ये है. अग्निसंदीपनार्थं च रक्तसंग्रहणाय च दोषाणां पाचनार्थं च परम पित्तैः उपाचरे. That is what he has said. चरक चिकित्सा स्थान. परम पित्तैः उपाचरे means गुरुची. That is the best thing you can give. Because गुरुची is a रसायन also. अतिशय उत्तम पित्त शमन करणारा आहे आणि it is helping the गर्भाशय also. It has the properties of संधानकारक गुणधर्म ऑन द एंडोमेट्रियम. सो योनिनां वातालाद्यानां यदुक्तमिह भेषजं चतुर्णां प्रदरणां च तत्सर्वकारे धिषत् रक्तापिसरणां यच्च तथा शोणितपित्तीनां रक्त अर्शसां च प्रोक्तं भेषजं तच्च कारयेत्. Why this is the sutra why we have used because in रक्त प्रदर चरक संहिता चरक चिकित्सा स्थान में ही मेंशन किया है कि अगर योनि में भी ऐसा होता है इज वेरी हेवी ब्लीडिंग अधोगर पित्त टाइप द ट्रीटमेंट इज नॉट डिफरेंट. इट इज द सेम विच इज गिवन फॉर रक्तातिसार फॉर रक्त अर्श एंड अधोगर रक्तपित्त. एंड दैट इज वाई वी हैव मैं हमेशा बोलती हूँ कि गायनेक इज अबाउट एवरीथिंग. इट इज अबाउट सर्जरी, इट इज अबाउट चिकित्सा एंड इट इज अबाउट गायनेक itself. So this was the base of my treatment, what I gave to this patient. Next slide. So what did I give? I gave Nakeshar, Lodhra, Rasanjan and Ashok Dhanavati. These are very common drugs. ज़्यादा कुछ ये नहीं है लेकिन they are famous in their own and they are very effective in their own. Nakeshar, Lodhra, Rasanjan, Amalaki. That combination we give in our college. My PGs also know my formula now. थोड़ा सा ट्रीटमेंट हम देते हैं कॉमन, नॉट फार्मूला. आयुर्वेदा इज नॉट अबाउट फार्मूला ट्रीटमेंट. लेकिन उनको वो मालूम है कि मैडम अभी हेवी ब्लीडिंग है तो दिस पैटर्न शी इज गोइंग टू यूज. सो नाकेश्वर इज एलादी, नाकेश्वर गण, एलादी प्रियंगवादी, अंजनादी, चातुर्जात. दिस इज द डिस्क्रिप्शन ऑफ द मेडिसिन. लोहित लोध्र इज शोणित स्थापन संधानीय. स्कंदन जहाँ हमको स्तंभन चाहिए वहाँ हम लोध्र यूज करते हैं. रसांजन इज दारू हरिद्रा का रस क्रिया है. रसांजन that is used only 1.125 milligram in that whole churna. Then there is Ashok Dhanavati. This is also very famous drug. The combination worked very well, and then she started having regular menses first. And one fine day she came and told me that she has conceived. Next slide. Sushanubhe was given and amicoder syrup of Anil company that I used. उसमें सुपारी उगर वो रहता है जिसकी वजह से स्तंदन या स्तंभन बहुत अच्छी तरह से होता है. But be careful while giving to diabetic patient. If patient is even pre-diabetic, don't give. उसका टैबलेट भी आता है because it is very very over sweet that medicine. So be very careful while giving. Kushmandavale is one more medicine. And Mahatikta is very famous again for Rakta Pradhan. One of my PhD students, Dr. Archana Singh from Madhya Pradesh College, she is working with me at present. उसका half sample हम इधर कर रहे हैं. जैसे is our style of working. So I am using this Mahatikta Gluta Ekeri also, alone treatment, stand alone for many patients and they are getting very good results. So in conclusion, in menorrhagia and resultant infertility can be managed successful by Ayurvedic treatment. This is the gist of this case. Next slide. So this is case number 3. This case was, I am not disclosing the name because case paper भी दिखा सकती थी यहाँ पर. But the thing is, I want to discuss how it works. She didn't want to go for investigations and all. She was my regular patient. In the beginning, she had no history of any infertility or all. In fact, 2 बार वो MTP के लिए आई थी मेरे पास. So she came in the YMT OPD with an anxious for child since 3 years, and she has history of 2 MTPs, one before and one after her 5-year-old male female child. Her last MTP was done in 2015. After that, she was actively trying to conceive over around 3 years, but couldn't conceive. And again, in spite of irregular coitus, she was not having a child. So the first thing which came in my mind was whether her DNC, but दोनों time उसने abortion with MTP pills किया. So there was no question of DNC and rigorous curating and Asherman syndrome. So that is why I just told her that we will do some investigation and we will go for Panchadan. But she said कि अगर हुआ तो हुआ ठीक है. I am not interested in the investigation. It's okay. One child is also okay for me, but you please give me Panchadan. I said okay. एक आध दूसरे cycle से क्या होता है? So I started. But in 2-3 cycles only she conceived. She was very happy. But ऐसे बोलते हैं ना कि एक बार आदत लग जाए एमटीपी pills की तो वो लगती है because after the second child also she got conceived with this baby. After that also again from 2 years ago she had come back to me for a third MTP and that time I had scolded her. You don't do this. Either you do to your puberectomy. Now you are having 2 children. So as a gynecologist, we have to counsel the patient in other things also. They think that MTP pills are so easily available on the counter. तो उसमें क्या होता है 2-4 बार मेंसेस इरेगुलर हो जाएगी उससे क्या होता है but you should tell them that this is not the right thing to do. Next slide. So the treatment given was Shatavari, Folvite, Ashwagandha, Palagruta, Yog Basti, which I told you in the last slide also. And in some cases, I give Pratham Mas Dhanavati in the beginning only. Madhukam Shaka Bijam. You all know that श्लोक of Pratham Mas गर्भस्राव के लिए जो काढ़े दिए थे सुश्रुत में. That also I use in my practice many times. So after menses, after ovulation जो पीरियड आता है बीच का उस टाइम I start the Pratham Mas Dhanavati और काढ़ा. Because see second मास हम कब स्टार्ट करते हैं जब यूटी पॉजिटिव आती है. So that time we start the second month. So first month का काढ़ा is actually it is the one who is helping you to ग्रहण करना जो गर्भ का रहता है that helps in the प्रथम मास धनवती helps that way. And मधुकम शाक बीजम ऐसे कुछ 2-3 द्रव्य है उसमें which are very famous. Next slide. So this is a before and after reports, investigation, the chart which we had prepared, and she got conceived at the end. Next slide. तो कार्य कारण भाव, हाउ दिस एक्ट, जैसे मैंने पहले भी बोला, अपन का श्लोक हमेशा याद रखना। अगर वो इवन इफ इट इज नॉट बाय हार्ट, एटलीस्ट लर्न द उसका क्रिया कैसी होती है वो देखो। अपानो अपनगः श्रोणिर्बस्ति मेघ रुगोचरः, शुक्र अर्थव शकृत मूत्र गर्भ निष्क्रमण क्रिया, नाभि प्रदेशम कटी पार्श्वम कुक्षिम गत्वा सकृत दोषचयं विलोम्यः, संस्नेय कायः सपुरुष दोष सम्यक सुखेन इति च बस्ती। तो अपान पर काम करने वाला बस्ती है, एंड हाउ बस्ती इज एक्टिंग यू कैन सी वेरी वेल। नेक्स्ट स्लाइड। So this is case number 4. Uh, this is about male infertility. A couple with a chief complaint of inability to conceive since 10 years came to our IMT college, newly married. They were married since 11 years, sorry. And both male and female factors were investigated. Female spouse showed normal USG and hormone test results. Everything was normal. But the male companion, उसका थोड़ा सा count कम था. It was 1 million, and then but first stage for 1820. We treated him first with antibiotics. I use antibiotics also, जैसे time मिलता है, I mean वक्त की नज़ाकत को समझ के उसकी जो जो जरूरत है, जैसे in females also I have to give the fastate and cleansen vaginal tablet in the beginning. The same way we treated this also. After that I went to Ayurvedic, and next slide. So this patient had no prior history of surgical or medical anything special. Next slide. Personal history also okay. Next slide. Next slide. So this is the before and after. Before treatment, his count was 1 million. Next. Now I'm going to talk about Mustadi Apan Basti, which we had given for male infertility. And the credit goes to my PG. The PG working that time was Dr. Pooja Koli. And she herself, she was, what we used to, we have a habit in our college कि हर पीजी को कम से कम 2 या 3 रिसर्च आर्टिकल कंपल्सरी रहते हैं, इन स्पेशली स्कोपस इंडेक्स ऐसे, मतलब स्टैंडर्ड जर्नल, एंड फॉर दैट वी मेक देम सिट इन द लाइब्रेरी एंड स्टडी. So she was studying Panchakarma in Gyne, and that time she came across this and she said कि मैम ये नया पेशेंट है, उसको हम यूज करेंगे. I said why not? Surely we will go along. And then we told them मुस्तरी अपन बस्ती का वैशिष्ट्य ये है कि उसमें मांसरस यूज करते हैं. तो वी हैव टू एक्सप्लेन टू द पेशेंट कि अगर वो नॉनवेज खाता नहीं है तो उसको एक्सप्लेन करना पड़ता है, क्योंकि वो उसको खुद को जाके लाना पड़ता है वो मटन मार्केट से, एंड दे हैव टू कम हियर एंड गिव इट टू द पंचकर्मा डिपार्टमेंट, और उस मांसरस में बाकी द्रव्य डाल के फिर उसका उसको यापन बस्ती देना है. So this yapan basti we gave it to him, and this is the way it has to be uh, given. Okay, so this is the next slide. The procedure is given in the next slide. So this is the shloka of Mustadi Yapan Basti. Yapanasya Bastya Sarva Kala Deyaha. इसमें एक स्पेशल ये लिखा है कि वीर्य प्रद या बलजनन, and because of that along with other things we are giving it for Vandetvu also. Next slide. अदर थिंग्स ऐसा नहीं कि हमने और कुछ नहीं दिया. मुस्तारी अपन बस्ती के साथ विश्वघृत, इसका भी रेफरेंस इसमें है चरक में. एंड आई थिंक पोद्दार मेडिकल में तो ज्यादा सब बहुत सालों से ये सब देते हैं. ऐसा जैसे बोलते हैं ना आप टेस्ट वचर, ऐसा कुछ कुछ कॉम्बिनेशन करके हर एक टीचर ने अलग अलग कॉम्बिनेशन करके ये तैयार किया है. हमारे इधर भी फॉलो और चरक हैज गिवन. उसमें सालम पंजा करके एक है, मंजिष्ठा सालम पंजा, देन शतावरी अश्वगंधा श्वेत मुसळी बला अतिबला, and जायफळ 2 नग, दैट इज द स्पेशलिटी. तो सब गोघृत एंड गोघृत ऐसा वो कॉम्बिनेशन है, वो हम वहाँ प्रिपेयर करते हैं हमारे कॉलेज में. कैप्सूल रेजिस परलिन पालेप सर का है. एंड पंचकर्म अनुवसन बस्ती वॉज गिवन. Then day 2 to day 7 Mustari Apan Basti continued. Then day 8 Anuvasan Basti with Sahachar Tel Basti. And as Mustafan Basti is a type of Niruma Basti, again day 1 and day 8 Anuvasan Basti was administered. Next slide. So these are the results which we can see the after treatment, and basically patient got conceived also. Next slide. Yeah, so this is the last, I think only 2
काय आहे
cases
तुमचं
remain. I think people
बद्दल
are
आता 4 वाजून 5 वाजून जेंट्स
people must be getting restless. If they want to hear the other cases, it's okay. Otherwise, Ramdas sir, it's getting lengthy.
No, ma'am, no. Please
हो
continue,
मॅम.
ma'am.
एकदा मी सरांना पाठवते ECG. ठीक आहे. ओके थोडेसे कमी आहेत
Shweta
आजीचे
madam,
असं
please
काही असं
mute. Okay, so now we will come to case 5. This is PCOD with right tubal block. Now this I am talking of early intervention. इसका भी नाम मैं बता सकती हूँ, नेहा देशमुख अभी 22 की केस है, 2022. The thing what I just told you before, that पहले ऐसा होता था कि सब करके पेशेंट अपने पास आते थे. Now this patient, I presented this case in last year का seminar also, because what I want to say is, if the patient comes early to you, not necessary कि Ayurveda is going to take time. This patient, she knew my work in PCOD. She had come to me before also in 2019 with PCOD. That time she had taken a little treatment and she had gone. Like ऐसा होता है ना, बड़ा वाटल्यानंतर एक बार अच्छा लगे तो पेशेंट नहीं आता. But then she had a love marriage, late marriage हो गया उसका, and for some reason they were waiting, like the engagement करके रुक रहे थे. But when she got married, she remembered, na, she knew that she is having PCOD. So before having any problems, immediately she came to me, and within 4 months of marriage, and she said कि मैडम, सॉरी, मुझे ऐसा लगता है कि मुझे प्रॉब्लम आ सकता है, so you better treat me now. So this patient's name is XYZ. Here I am not mentioned it. Married, she is a lawyer by occupation, and known case of PCOD since. Okay. Known case of PCOD since 2019. Latest USG done was 2022. Now this time also her PCOD was there. No surgical history. Next slide. So she was willing for child since 4 to 5 months. In view of her late marriage and history of PCOD, she thought of taking treatment immediately after marriage. Usually infertility हम कब बोलते हैं, 1 साल का अगर coitus है and all that. But in her case, she was not infertility, but she was aware that PCOD may cause problems, and hence she came to me before only she was labeled infertility. That is why I am presenting this case. She had irregular menses since MENA. Next slide. So investigations हम जो करते हैं वही किए, thyroid and everything. Next slide. Clinical examination was normal. Next. फक्त LH and FSH was correlated to the, as you can see, LH is more and FSH is less. That is a sign of PCOD. Next slide. Next slide. So she was also put on Shatapushpa regimen. Her weight was more. That is why she was given 24 grams of at fasting 5:30 a.m. Ashwagandha Kshirapak, yes, one thing we added in this. Most of the people know that ashwagandha is a very good fertility or ovulation करने वाला द्रव्य है. तो उसका क्षीरपाक बना के we gave from day 1 to day 12 of menses. So that way, that also helped in ovulation. Charted Uttar Basti because she was having tubal block. Palakruta Uttar Basti from day 11, day 10 to 11. And lastly, Rasantel Basti. Again, this is one of my PhD students, Dr. Swati Pathare, who is a reader in Vada College, Ideal College, Vada. तो शी इज माय पीएचडी स्टूडेंट. उसका ड्रग था वो. था मतलब है रसोन तेल. एंड वो काश्यप संहिता में मेंशन किया है, रसोन कल्पार्थ. दैट इज व्हाई आई सेड अगर आपके पास नहीं है तो काश्यप संहिता प्लीज बाय करो. आपके रेगुलर प्रैक्टिस में उसका बहुत आपको रिजल्ट आने वाला है. तो उसका अवलेह अध्याय, उसका रसोन कल का अध्याय, उसका शतावरी शतपुष्पा अध्याय, देयर आर मेनी थिंग्स विच काश्यपा विल हेल्प यू. तो ये रसोन तेल बस्ती भी उसी का है. उसने बताया उसमें कि रसोन तेल का अगर बस्ती दें या अदर पंचकर्म भी आप यूज करें तो वो वीर्यप्रद है, वो गर्भप्रद है. नेक्स्ट साइड. नेक्स्ट साइड. So treatment given orally was Kumari Asav, Gandhava Haritaki, Shankhavati Shatapushpa Purna. Then Panchakarma was Shatapushpa Tel, Matra Basti, Sahachar Tel. HSG was done, of course. Investigations were done. HSG, follicular study. August, this is the timeline of the patient. Next slide. And yes, in Jan 2024, she conceived. Yeah. November 2023 को उसको ये हो गया. रसोन तेल मात्रा बस से स्टार्ट किया था. 2-3 साइकिल्स हो गए. एंड इन जनवरी शी केम एंड टोल्ड अस दैट उसका यूपीटी पॉजिटिव है. नेक्स्ट स्लाइड. या. So the main thing is she was having PCOD with triple block, but because of early intervention उसका ज़्यादा टाइम नहीं गया है ना. तो ज़्यादा टाइम वेस्ट न करते हुए she got good treatment. She could avoid IVF and all those things. And she is a very happy person today. She has given me a testimonial also in front of the NCIS and the inspector. Next. So these are before after reports. Next. This was her HSG report. Next. Now this is one other case. इसके बाद एक ही केस है फिर. Don't worry, ज़्यादा मैं ये नहीं करूँगी. आदित्य बोल रही है why I'm mentioning this cases. Actually वो बाद में मेरे पास आई भी नहीं. But the thing is she was suffering from this severe dysmenorrhea. मतलब इतना पेन था उसको, इतना पेन था कि कुछ भी tramadol लो, कुछ भी लो. Everyone was in a family was fed up with her dysmenorrhea. So she was a married patient, and she came to me in I think in the post-COVID days, 2021 maybe. Next slide. So her chief complaints were heavy menstrual bleeding since 8 to 10 months, severe dysmenorrhea since 1 year, chronic pelvic pain, intermittent and dull. तो इसके जो ये था sonography, the sonography showed adenomyosis. Next slide. Investigation showed bulky uterus with heterogeneous myometric ecotexture, ill-defined myometric cyst, and basically it was adenomyosis. And her uterus was very large, 10 to 12 week size. That was because of the adenomyosis only. And अगर देखा जाए तो the allopathic people had told her कि there is no treatment only for this, either bear it or remove the uterus. And since she was just married, there was no point only in going for that. That is why she came for Ayurveda. Next slide. So then I give her the usual treatment. आहार, आयुर्वेदिक मैनेजमेंट, कंजम्पशन ऑफ फूड, आहार का सब बताया उसको, योगा बताया मैंने. एंड आई गेव हर ओनली कंजर्वेटिव ट्रीटमेंट, पंचकर्म एंड पेन किलिंग मेडिसिन. नेक्स्ट टाइम. So then panchakarma basti was given, and as in endometriosis or adenomyosis, pathogenesis due to vivargagaman of the vata dosha. Basti pacifies the vata dosha and diverts to normal anunoman gati of the vata. So this only basti are given. Next slide. So before talking about how basti has acted, I will just tell you what is endometriosis. It means the endometrial tissue has grown outside the uterus. Next slide. Adenomyosis means the endometrial tissue is in the muscle and not in the endometrium. मतलब दोनों का संप्राप्ति एक ही है. Next slide. Now, if you go to see Atipravritti Sangova, Sirayam Pranta Yotiva, Vimargagamaram च अपि स्रोतसाम दृष्टी लक्षणम. Now, if you can see स्वतःची जागा सोडून एंडोमेट्रियम दुसरीकडे जातो, so that is the sign of विमार्गगमन. उस विमार्गगमन को अनुलोमन करने का काम अपन वायु का है, and that the bust does. Next slide. So this was the reason why I wanted to mention this. अगर आयुर्वेद की दृष्टि से देखा जाए तो this comes in विमार्गगमन of the ये प्रोडक्ट, मतलब आर्तव स्रोतस है तो आर्तव का विमार्गगमन. Unfortunately, this patient didn't want to keep. Pregnancy is the answer for adenomyosis. Actually, allopathic people also tell that also कि pregnancy है तो वो निकल जाएगा आपका. Endometriosis के भी pregnancy उत्तर है. But for some reason, she did not want the baby and she kept on saying कि no, 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 मुझे नहीं चाहिए, नहीं चाहिए. And in my career of so many years, this was the first time I felt so bad while giving her MTP pills and all those things. But I counseled her too much कि ऐसा मत करो because that is the answer for your dysmenorrhea. But वो उसने सुनाई भी नहीं, बाद में आई भी नहीं कभी. But I will remember this case because she gave me the direction of these things. Next. And the last case now I'll tell. Next. Now Makkal, yes, 1 minute. ये जो why there is a severe pain in adenomyosis and endometriosis, the reason is अगर आयुर्वेद की दृष्टि से देखा जाए तो मक्कल करके एक व्याधि है. उसमें रक्त मारुतेन शुंडा म्हणजे रक्त जमा हुआ खून हमेशा पेन ज्यादा निर्माण करता है. देयर इज मोर टेंडरनेस देयर, और ये जमा हुआ खून रहता है अंदर. whether it is in the endometrium, whether it is outside the endometrium or anywhere else. बट जहां जहां जमा हुआ खून है वहां वहां मक्कल है. just it is just that we are not calling it मक्कल. ठीक है. So this is one concept which I wanted to tell you. Next. Next. Okay, and now this is the last case why I told you में जो लिखा है कि वंजुटी या जो औरत है जिसका मेनोपॉज हो गया है उसको भी रहता है. आई जस्ट टेल यू दिस इंटरेस्टिंग केस. दिस पेशेंट came to me for PCOD only. Her main fever. Next slide. अभी की एज है 25 की. नेक्स्ट स्लाइड. नेक्स्ट स्लाइड. हाँ, so her complaint was irregular menses, heavy bleeding, and no other major thing. She had 2 children also, and she had done a tuberculosis. Please note this. Next time. Next slide. Now she came to me for treatment for hair loss, and we gave her PRP also for that. Okay. So that is the plasma ये therapy रहता है ना, PRP. So then that treatment also we gave her. इसको hair fall भी कम हो गए हैं. लेकिन main thing is in spite of having a tuberculosis, she conceived. So that is why we say as a joke कि शतपुष्पा ने यहाँ पे काम कर दिया. So that is why I said this is a funny incident. But of course, when she came, she was not willing for that, and her pregnancy also very suddenly we came to know because since she was having a tuberculosis done, we didn't think only कि उसको pregnancy रहेगी, and that is why her menses and all we were treating with those that thing in mind. Suddenly she came to us in emergency कि मुझे बहुत पेन हो रहा है, टिपिकल लाइक अपेंडिसाइटिस. इसको देख के ही मुझे लगा कि ये अपेंडिसेक्टोमी का नहीं है, ये शायद इसको एक्टोपिक होगा. एंड देन वी ऑपरेटेड हर. उसका एक्टोपिक निकला एंड शी गॉट ट्रीटेड. शी इज वेरी फाइन एंड हेल्दी. एंड उसका रिपोर्ट मैं दिखाती हूँ आपको 1 मिनट. जस्ट शो मी द स्क्रीन. हेलो, जस्ट शो मी द स्क्रीन. हॅलो.
हाँ मॅडम.
I cannot see the screen. मला सगळी हे दिसत आहेत, पार्टिसिपंट्स दिसत आहेत. स्क्रीन दिसत नाही मला. नाही, स्क्रीन नाही दिसत आहे मला.
कोणतं?
त्याच्यात मला हेच दाखवायचं फक्त की तिचा आधीचा रिपोर्ट आहे आणि नंतरचा आहे. शी केम टू अस त्यावेळेसचा सोनोग्राफीचा रिपोर्ट है, त्यात उसमें पीसीओडी है और अभी उसको पीसीओडी नहीं है. तो द पीसीओडी वॉज ट्रीटेड विथ शतपुष्पा रेजिमेन. द जोक ऑफ इट, जोक म्हणण्यापेक्षा फनी पार्ट म्हणता येईल या इस केस के बारे में, कि जो हम वैसे ही बोलते हैं शतपुष्पा में कि जो नष्टवीर्या है, जो नष्ट आर्तवा है, उसको भी बच्चा रहता है. तो इन हर केस कि वह फिकल्डिटी वॉज सो गुड कि 2 बच्चे होने के बाद 2-3 साल हो गए थे उसको फीवर कमी करके. बट मे बी आई डोंट नो हाउ इट हैपेंड. और शी वाज हैविंग पीसीओडी, हेवी ब्लीडिंग था, इसको सारा हेवी ब्लीडिंग का मेडिसिन मैं दे रही थी, जो मैंने मेनोरेजिया के बारे में अभी बताया. एंड द थिंग इज बट स्टिल apart from the PCOD getting okay, she conceived also. And yeah, of course ectopic is a very serious, म्हणजे ते जान पर आई उसके. लेकिन फिर भी the thing is that शतपुष्पा worked. That is I want to say. ठीक आहे, मला काही दिसत नाहीये सर. मला काही म्हणजे स्लाइड्स दिसत नाही. स्क्रीन
Ma'am,
नाही
you
दिसत.
just can swipe left or right. You can try swipe left or right. You can see the screen.
ओके, ठीक आहे. हा, सो नेक्स्ट स्लाइड. दिसलं मला. नेक्स्ट स्लाइड. नेक्स्ट स्लाइड. नेक्स्ट स्लाइड. हाँ, तो दिस इज द प्री ट्रीटमेंट. 14 फरवरी को आई थी वो दैट इज द रिपोर्ट. नेक्स्ट. Shatapushpa regimen is given for total 6 months. So first 3 months we have to give. First 3 months take only to regularization of the cycles, and the next 3 months to maintain whatever changes, positive changes have happened in the body. Most of the time, 3 or 4 months may patient conceive होती है. So these are her reports. Next, pre and post. So pre-treatment, she was having PCOD, adenomatic changes. Next slide. Treatment plan, Shatapushpa regimen. Next slide. And in August 2025, we repeated our sonography. In that time, there is no PCOD seen. Next slide. So significant regression of the PCOS morphology, improved follicular pattern, reduction in the uterine bulk, and overall radiological improvement. We can say the radiology has told us that this is PCOD has reduced, not gone, but reduced. Next slide. Outcome after 3 months. Yeah. Next time. Next slide. So for Shatapushpa regimen, they have to continue daily. No premenstrual, postmenstrual. From day 2 only she has to start. So discussion is PCOD is a chronic disorder. Shatapushpa benefit just now I mentioned, and holistic improvement with lifestyle. Contraindication as such काही नाही आहे शतपुष्पाचं. Having said this, if patient is complaining of acidity, some patients do say that मुझे बहुत vomiting जैसा होता है. अगर नहीं है तो yeah, and one thing, what we did a project on this also, that one group we gave Shatavari and one group we gave Shatapushpa. So Shatavari, because in that Abhay also he has mentioned, no, Kashyapa has mentioned that वो लीन भी होती है और ओबीज भी होती है ना. And Shatavari also he has said take in the same way like Shatapushpa. Means पहाटे उठून घेणं. First means जो regimen we are using for Shatapushpa same has to be used for Shatavari. We have tried to use it in lean patients. कुछ PCOD के पेशेंट बहुत पतले होते हैं, तो उस हिसाब से. Next slide. Yeah. Conclusion is this, that Shatapushpa showed major, and thank you very much फॉर अ पेशंट हिअरिंग मला वाटतं मी जास्तच बोलले जरा. ऍक्च्युली आय थॉट की नॉट टॉकिंग अबाउट द इंट्रोडक्टरी पार्ट, but then the thing is, if I don't give the introduction, what I am talking about the cases will be very uh, people will not understand. That is why I took so much time. Thank you.
Thank you, ma'am. Request to all audience, please ask your questions in chat box.
Um, First of all, thank you so much, ma'am. Time did really fly when the session was this good. And I think we were also so tuned in that the hour vanished before we knew it. So, beginning with beginning with question answers, I likely to from my heartful gratitude towards you, ma'am. And ma'am not only guided us here today with complex cases scenarios, but also helped us to appreciate the immense therapeutic potential of simple drug. One such example was Shatapushpa, a drug which is so commonly available, but with extraordinary application from its role in yoni, vikara, and PCOS and ovulatory disorders and to impact in digestion and water regulations. So personally, according to me, ma'am, I think we are 7 to 10 cases short. So it was a brilliant lecture. Thank you so much, ma'am, for your immense knowledge and sharing with us. And what more you ask? So we are now open for discussion. Please raise your hands and you can ask your questions in the chat box. Please free to ask. Ma'am will guide us one by
There
one.
is okay. There is a question about hydrosalpines and chocolate fish. Yeah. Thank you, Pallavi. Yeah. So this is regarding hydrosalpines and chocolate chips. Now, अभी जो मैंने बात की ना about गर्भिणी मक्कल or whatever, just मक्कल, not गर्भिणी मक्कल, but मक्कल हो या see basically uh, when in the beginning only I said कि what we do is we do diagnosis by allopathy and we treat by Ayurveda, right? Everyone is doing that. It's okay. Nothing wrong in that because we don't have any other option also. But the thing is that now hydrosalpines में क्या है? Basically there is water, जल है ना? तो जल है तो वहां पर क्या क्या काम करेगा? We have to talk about गुड़गुड़ only then. So but don't use कांचन or गुड़गुड़ here. Here you have to use गोक्षुर आदि गुड़गुड़. The reason is गोक्षुर is मूत्रल द्रव्य. तो गोक्षुर itself मधुर मधुर शीत और उसका प्रभाव क्या है? मूत्रल है. तो what will happen is गोक्षुर अगर आप देते हो तो उसकी वजह से उसका जल संचय कम हो जाएगा एंड उसके साथ गुड़गुड़ अगर है तो वो ज्यादा हेल्प करेगा. So I am not saying कि you avoid surgery, but at least 3 months you give panchakarma. And अगर उसको if it is conservative treatment is allowed. But either way, allopathic people also don't go for surgery immediately. They give some hormonal drugs and they don't have anything other than estrogen progesterone. They will give other नए नए कॉम्बिनेशन करेंगे लेकिन बेसिक वही दो ड्रग्स है ना जिस पर वो काम करें. तो हम वही कर सकते हैं ना, है ना? तो whether it is hydrosalpines, whether it is ovarian cyst, but just be in your limits. अभी परसों मेरे पास एक पेशेंट आई उसका सिस्ट 7 सेंटीमीटर है. ऐसे भी मत बोलो कि आयुर्वेदिक से होगा. टेल हर गो फॉर CA 125, CA 119.9, कैंसर मार्कर्स करो. उसका 5 सेंटीमीटर के ज्यादा है तो गो फॉर ऑपरेटिव. एंड उसके बाद बिकॉज सिस्ट अगर एक बार आया तो बाद में नहीं आएगा ऐसा नहीं. बाद में न हो इसलिए आप आयुर्वेदिक दे सकते. तो हाइड्रोसल्फिन्स एंड यू आर टॉकिंग ऑफ चॉकलेट सिस्ट. ना चॉकलेट सिस्ट इज द संप्राप्ति वही है ना जो मक्कल में मैंने बताई अभी आपको. रक्त मारुतजा शुलहा. मक्कल मीन्स साठलेलं रक्त, जमा हुआ खून. तो चॉकलेट सिस्ट इज नथिंग बट दैट. द ओनली थिंग जो चॉकलेटी रंग आहे तो त्याच्यामुळे आहे. दैट इज नथिंग बट एंडोमेट्रियोटिक सिस्ट जो चॉकलेट सिस्ट बोलते हैं. तो उसके लिए भी आपान पर ही कार्य करना है आपको. रक्त विलयन द्रव्य देना है एंड along with that you give गोक्षीर शुद्ध घृत या see how the patient is. अगर हेवी वेट है तो don't give घृत, don't give गोक्षीर शुद्ध घृत, just give गुग्गुळ. तो and you do पंचकर्म. पंचकर्म के आप उसके बिना हो ही नहीं सकता ट्रीटमेंट आयुर्वेदा में. Okay. Can you explain how to approach PCOD with low BMI? Yeah, exactly. Now, yeah, thank you, ma'am. Thank you, Kundan. That's what I said ना कि शतावरी शतपुष्पा अध्याय में ही उसने बोला है लीन एंड ओबीज दोनों का उसने संगम किया है काश्यप हिमसेल्फ. सो लो बीएमआय म्हणजे काय लीन पेशंट असणार ती जास्त आणि त्याच्या वेळेस तुम्हाला शतावरी वापरायची मोर दॅन शतपुष्पा बिकॉज शतपुष्पा इज मोर ॲज अ शोधन द्रव्य. शतावरी इज गृहन प्लस शोधन द्रव्य. Young gay patient age one case pending hemorrhagic cyst can't be conceived in that cycle. Actually, I'm losing 1 minute. Let me see the chat box. One case patient has tendency of hemorrhagic cyst. She can't conceive in that cycle. What should be done? When she is sticky, this cycle with 4 times. अगर उसका basically two things we have to think then. Hemorrhagic cyst है तो again पंचकर्मा and medicines and she cannot bulky uterus है plus menses are sticky. So you have to think of रक्त प्रसाधन द्रव्य here and you have to do the hormonal test. पहले hormonal test करो उसके FSH LH वगैरह because unless there is hormonal imbalance it is not going to reflect in the menstrual cycles. So if there is any, and yes, you have to do a local examination. Sometimes there is a infection, there is PID, and that chronic PID also leads to sticky menses. Then next question is, Pratham Mask Dhanavati, yes, it is available in pharmacy. ये विद्यानंद लैब्स जरूकर का जो है वैद्य जरूकर उनका है बाकी लोगों का भी है बट आई नो देम बिकॉज आई एम यूजिंग इट सिंस मेनी इयर्स ना दैट इज वन. Then other PCOD with menorrhagia, how can we treat it? PCOD with menorrhagia, as I told you about the second case, सब रक्त प्रसादन द्रव्य एंड अग्नि संदीपनार्थम से जो वो नाट्यशर लोद्रा रसांजन या वो जो कॉम्बिनेशन है वो यूज करो एमी पाउडर यूज करो. मेनी ड्रग्स भी है अभी वो जो अगर हमारे पास आते हैं वो ज्यादा याद रहते हैं ना इसलिए आई एम टॉकिंग ऑफ एमिल कंपनी बट देर आर अदर हिमालय है सांडू है झंडू है देर आर सो मेनी people are working with the same combinations so you can use that and but one thing is there no treatment will complete without panchakarma that much I can tell you. Next is Chitrakadi Vati, no, and I don't have any idea. Chitrakadi Vati is of, I think, Chaitanya Pharmacy. Chaitanya
मॅडम
Pharmacy के drugs अच्छे रहते.
मॅडम एक प्रश्न होता.
हाँ बोला ना.
थँक्यू मॅडम, खूप छान, खूपच छान. फक्त उत्तर बस्तीच्या बाबतीत एक जरा प्रश्न आहे. इंट्रायुट्राईन बस्ती द्यायचा की वजनामध्ये ते पोस्टेरियर फॉर्निक्स मध्ये फक्त सोडलं तर चालतंय?
ऍक्च्युली त्याच्यावर आता मध्ये एक कॉन्फरन्स झाली ना त्याच्यात मी उत्तर बस्तीवरच पहिलं इंट्रोडक्टरी माझंच होतं लेक्चर काश्यपीमध्ये त्याच्यात ह्या वादावर मी बराच हे केलेलं आहे. ऍक्च्युली ग्रंथात जे सांगितलंय ना सर त्याच्यात गर्भाशयात टाका असं म्हटलेलं नाही. त्यांनी 20 ml हा हे प्रमाण दिलेलं आहे आणि ते 20 ml शक्यच नाही गर्भाशयात जाणं म्हणून तर नावडेज देर इज द थिंकिंग दॅट इट मस्ट बी फॉर द वजायना. तर वजायना डुशिंग जसं आपण करतो तसं ते तुम्ही म्हणता तसं पोस्टिरियर फोर्नायसिस मध्ये टाकलंय आणि त्याच्याशी लिमिटेड म्हणजे वल्वर डिझिजेस जर असतील किंवा फक्त वजायनल लिमिटेड असतील तर तिथे त्याचं काम होईल. पण आपण ऍडव्हान्स शास्त्र आता जर आपले शास्त्र एवढं पुढे गेलेलं आहे आणि उत्तर बस्तीचे जर रिझल्ट येत असतील तर जस्ट बिकॉज ग्रंथकारांना काहीतरी वेगळं म्हणायचं होतं म्हणून आपण आपलं हे का बंद करायचं. आणि त्यातनं ज्यांनी उत्तर बस्ती यंत्र जे सांगितलेलं आहे त्याच्यामध्ये त्यांनी जे प्रमाण सांगितलं आहे ते गर्भाशयाचे. सो देर इज अ कन्फ्युजन इन दॅट जे आपल्याकडे अवेलेबल रेफरन्सेस आहेत आजच्या घडीला. सो मे बी सम ऑफ देम मस्ट बी लॉस्ट इन in the period in between. जसं काश्यप संहिता पूर्ण नाहीच आहे आपल्याकडे. वी हॅव ओनली 3 or 4 अध्याय, त्याच्यावर आपण काम करतो. देर आर सो मेनी थिंग्स विच आर मिसिंग. द सेम टाइम मस्ट बी अबाउट उत्तर बस्सी ऑल्सो. सो इव्हन इफ तसं जरी असलं तरी त्यांनी काळ बरोबर दिलेला आहे. त्यांनी उत्तर बस्सीचा काळ त्यांनी बरोबर सांगितलंय की गर्भाधान काळाच्या वेळेसच ते द्यायचं आहे. म्हणजे जेव्हा दिस इज ओपन, काय म्हणतात त्यांना, ऑस इज ओपन अँड द एरिया इज फेवरेबल फॉर प्रेग्नन्सी. असेच ते श्लोक आहेत, पण आत्ता ते माझ्याकडे नाही आहेत माझ्याजवळ. बट येस, आय कॅन गिव्ह इट टू यू टू कॉन्टॅक्ट मी
मॅडम,
आफ्टरवर्ड्स.
म्हणजे ते नुसतं 6व्या-7व्या दिवशी द्यायचं किंवा 6व्या, 7व्या, 8व्याच दिवशी द्यायचं असं काही नाहीये. 14व्या दिवसापर्यंत आपण देऊ शकतो रोज.
देऊ शकतो, पण कसं आहे, ती बेस्ट इज यू शुड डू इट, गिव्ह इट प्री ओव्ह्युलेशन. त्याचं सिम्पल रिझन असं आहे की 90% उत्तर बस्ती आपण प्रेग्नन्सीसाठी देतो, बरोबर. तर ओव्ह्युलेशन जेव्हा होतं त्याच्या जसं आधी आपण जर सुरू केलं 7th, 8th, 9th to 11th डे, म्हणजे आता आम्ही आमच्याकडे 5व्या दिवसापासून ते 5th डे टू 5, 6, 7, 8, 9, 10 किंवा 7th डे टू 11th डे देतो. म्हणजे जेव्हा तिचं ओव्ह्युलेशन ऍक्च्युली होतं त्यावेळेस तिचं युटरस इज प्राईम, द एंडोमेट्रियम इज प्राईम. दॅट इज वाय कन्सेप्शन हॅपन्स व्हेरी फास्ट. तुमचा हाच प्रश्न होता ना?
हो हो मॅडम, हो मॅडम, अगदी. थँक्यू मॅडम, मस्त.
फायब्रॉइड साठी येस, आय गिव्ह चंद्रप्रभा, गोक्षुरादी गुगुळ अँड सुकुमार काढा देते मी. काय ते साऊथची कोणती कंपनी ती, वैद्य, नाही कोट्याकल, सॉरी, सुकुमार काढा कोट्याकल. पण छोटे फायब्रॉइड असतील तर जातील, ते कमी होतात. पण खूप मोठे असतील तर डोंट गो फॉर दॅट, गो फॉर सर्जरी. बिकॉज जेवढा मोठा फायब्रॉइड तेवढा तर तुम्हाला त्रास देणार ना फक्त. शतपुष्पा रेजिमेन मीन्स ओनली शतपुष्पा. शतावरी रेजिमेन इज शतावरी. दोन्ही एकदम वापरायला नाही सांगितले डॉक्टरांनी. नेक्स्ट क्वेश्चन इज,
मॅडम,
डिलेड
शतपुष्पा
ओव्ह्युलेशन.
रेजिमेन मध्ये, सॉरी सॉरी मॅडम,
हा,
शतपुष्पा रेजिमेन मध्ये शतपुष्पा जे तुपामध्ये भाजून सकाळी ज्या वजनानुसार तुम्ही खायला सांगितले ते सकाळी 5:30 वाजता खायचं.
बरोबर,
त्यानंतर दूध
ब्राह्ममुहूर्त.
भात जे खायचं आहे ते नाश्त्याच्या वेळेला खायचं आहे.
हा,
आणि
बरोबर.
त्यानंतर मग पेशंटने दिवसभर त्याला जसं भूक लागेल तसं
त्याला
खाणं पिणं ठेवायला हरकत नाही.
हवं तसं खाऊ द्यायचं. फक्त जेव्हा ते सुरू करतील तेव्हा त्यांना सांगायचं की तुम्ही ऑब्झर्व करा की तुम्हाला भूक कधी लागते. तर शतपुष्पा हे हेवी आहे. बरेचदा पेशंटला भूकच लागत नाही 2-2 वाजेपर्यंत. मग त्यांना ते एक्सप्लेन करायचं की भूक नाही लागली, तुम्ही नाही खाल्लं तरी घाबरू नका, कारण ते रसायन द्रव्य आहे. त्याने तुम्हाला काही चक्कर वगैरे काही येणार नाही. आणि हळूहळू शतपुष्पाने वेट लॉस पण होतो.
मॅडम, आता एक मेल पेशंट आहे ज्याचा आता एक टेस्टिस अगदी मोठा आणि स्टोनी आहे आणि त्याला आता अजुस्पर्मिया आहे.
बरं.
तर त्याला आजच मी इन्व्हेस्टिगेशनला USG ला पाठवलोय. तर त्याच्यामध्ये हे शतपुष्पा रेजिमेन करू शकतोय का आपण तुमच्या आता नवीन अभ्यासाच्या नुसार?
शतपुष्पा म्हणजे हे बघा, ग्रंथकर्त्यांनी शेवटी काय सांगितलंय की हे जे आता पुमानिती, म्हणजे आतापर्यंत मी जे काही बोललोय, म्हणजे काश्यप काय म्हणतो, हे जे काही मी आतापर्यंत बोललोय ते सगळं पुरुषांना सुद्धा लागू आहे. म्हणजे जे काही आहे, लो स्पर्म काउंट, टेराटोझर्मिया, अझिस्पर्मिया, व्हॉटेवर जे काही पुरुषाचे इश्यूज आहेत त्या सगळ्यांना याच रेजिमेंटने तुम्ही वापरून बघा. वी हॅवंट यूज इट येट, वी विश टू यूज. वापरायला काही नुकसान तर काहीच नाही ना त्याचं. इथे तो रसायन द्रव्य.
हो
आणि
मॅडम, कळवतो
शतपुष्पा
मी
म्हणजे
तसं.
100 पुत्र होण्याच्या कपॅसिटी असलेलं. फक्त तुम्ही जे सांगताय तिथं सर्जिकल ओपिनियन घ्या. त्यांना काय म्हणायचं, वाय इट इज स्टोनिंग, वाय द साईज इज मेड, है ना. यू हॅव टू इन्व्हेस्टिगेट ना ते कशामुळे आहे.
येस मॅडम, थँक्यू मॅडम.
ठीक आहे, मला वाटतं झालंय सगळ्यांचं. हा, एक प्रश्न आला, इफ विस्कोसिटी ऑफ सीमेन इज मोर, व्हॉट इज द ट्रीटमेंट? विस्कोसिटी ऑफ द सीमेन इज मोर याचा अर्थ कफदृष्टी आहे सर, ओके ना. मग कफदृष्टी असताना, या कॅन यू एक्सप्लेन इन इंग्लिश? ओके, शतपुष्पा, it has to be taken in the Brahma Muhurta. I think you will understand in English. That is around 3 to 6 a.m. है ना, early morning. So you take it at 5:30 चबा चबा के खाने को बोलो पेशेंट को, टेल द पेशेंट टू chew it very nicely because the action starts from the saliva only. Then after she can drink hot water with it. After that, at the first hunger pangs, around 9 or something, she can have rice and milk. राइस में नमक नहीं है, मिल्क में शक्कर चल सकती है. आफ्टर दैट दिन भर शी डजंट हैव टू यूज. ठीक है. लुकोरिया ट्रीटमेंट फॉर सीवियर डिस्चार्ज. लुकोरिया में या देर इज रोली धावन है. आपण उसी बाय द लुकोरिया, एक्चुअली लुकोरिया इज अ टोटली सेपरेट टॉपिक फॉर लेक्चर, बट स्टिल आई विल टेल यू. लुकोरिया उसका कारण देखो पहले, व्हाट इज द रीजन. वो फिर ल्यूकोरिया कैसा है, वाइट थिक कर्डी है या वाटरी है या स्टिकी है, सी दैट. And then you will have to treat the husband also. If you have not treated the husband, she will have severe discharge. So the husband also has to be treated. So in the beginning, it is the first visit, and if she has not taken any allopathic for the past 6 months, you can give a proper course of Fastit and Indian vaginal tablet, but give it to the husband also. 90% लोक don't give it to the husband, and then the infection continues because it is a sexually transmitted infection. This is not an STD, it is RTI, reproductive tract infection, but it is because of that only. So that is why you have to treat the husband and wife both. उसके बाद फिर उसको यूनि धावन, अपामोगसार प्रतिसारण, उपशानुग चूर्ण, टैबलेट पेंटाफाइल, पालेट सरका, पंचवल्कल चूर्ण, पंचवल्कुल काढ़ा, ये सब आप यूज कर सकते हैं वाइट डिस्चार्ज के लिए. एंड यस, यू हैव टू चेक हर एचबी ऑल्सो बिकॉज एनीमिया की वजह से भी वाइट डिस्चार्ज होता है. हाई प्रोलैक्टिन लेवल्स वी गिव काढ़े चिराई काढ़ा 20 ml per BD and into 3 months. याचा आमाशय रस रक्त शुक्र शतपुष्पा शतावरी याचा आमाशय रस रक्त शुक्र परिणाम विषयी मार्गदर्शन करावे. त्याचा रसवीर्य विभाग बघा सर. रसवीर्य विभाग शतावरीचाच जर बघितला तर पित्त रस, अनुरस इज मधुर आणि मधुर आणि शीत आहे, रसायन आहे. इट स्टार्ट्स विथ द रसवस स्वतः ओनली. रस रक्त असं करत करत त्याचा मार्ग होतो, अँड दॅट इज वाय इट ऍक्ट्स ऑन द अर्थ, है ना. श्री 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 शुक्र किंवा त्याला अर्थ म्हणू शकतो. आमाशयावर ऑफकोर्स सगळ्याच द्रव्यांचं काम होतं, तसं त्याचं पण होईल. शतपुष्पा उष्ण आहे, बट जसे अश्वगंधा कार्य करतं उष्ण असून सुद्धा, द सेम कार्य शतपुष्पाने सुद्धा होईल. ठीक आहे. Okay, thank you. Thank you, everyone. I think we have to stop now.
Okay. Thank you so much, ma'am.
Yeah.
Any other questions?
One question, ma'am. When there is delayed ovulation, can we do IUI? In delayed ovulation?
Actually, delayed ovulation में भी कर सकते हैं, but you have to see. You must be doing sonography, no, before doing IUI. Then you can do. No problem.
Yeah, ovulation is mostly on 20 and 21st day or 22nd day.
You can do IUI, no problem.
Okay, ma'am.
But त्यासाठी afterwards you have to give some other drugs, like जैसे मैंने बोला, if you are following allopathy, then according to that you have to give other medicine. म्हणजे जो जो हम IUI के लिए देते हैं ना, सस्टेन वजाइनल टैबलेट, देन एस्पिरिन 75 mg डेली, फिर एलॉक्जिनाइन सैशे, वो you have to continue that. And if you want to add,
I use Ayurvedic medicines like leptadin and garbhapal ras, like that.
Okay, but you can use allopathic also. See, माझं म्हणणं काय असतं, if you are using IUI तो हम एलोपैथी से ही कर सकते हैं ना. We are following that technique, so why not use those drugs also? So you can use this, what I'm saying, even if it is late ovulation. The thing is, if she is ovulating every time she is ovulating late, इसका मतलब आयुर्वेदा के हिसाब से उसकी कफ प्रकृति है मैडम, है ना.
Okay.
कफ प्रकृति के लिए आप जो ट्रीटमेंट दोगे, कोई भी पेशांधान कारक, वो आप कोई भी द्रव्य वहाँ फायदा करेगा. नॉट ओनली शतावरी, अश्वगंधा एंड अदर विदारी तंत्र, अतिबला, बला, ये भी वहाँ काम करेगी. जीवनीय गण काम करेगी. You can give that. Apart from, if you are already using Leptadine, then you can use something else this time. Use Pratham Mas Dhanavati to increase the endometrium receptivity. Dadi Madhyam, Palar Kalyan. There are so many. Okay. And I will say, all of you, I will suggest you buy Kashyap Samhita and you buy Sharangal Samhita also and Bhava Prakash also. इसमें खजाना है आयुर्वेदिक मेडिसिन का. जितना आप ढूंढोगे उतना ज्यादा मिलेगा आपको. एंड इस तरह से नए नए मेडिसिन भी आएंगे मार्केट में. ठीक है.
Any other questions?
Hello, ma'am.
Yes.
Please turn on the video if you're asking questions. It would be better.
एक पेशंट आहे, तर त्यांचं म्हणजे सगळं जे आपण हार्मोन स्टडी करतो किंवा USG असेल ते सर्व नॉर्मल येतं. USG मध्ये पण काही नाही दिसत. प्रत्येक महिन्याला व्यवस्थित ओव्ह्युलेशन पण होतं आणि एंडोमेट्रियम थिकनेस पण व्यवस्थित असते आणि ट्युबल ब्लॉकेज वगैरे साठी पण केलेलं ते पण नॉर्मल आहे. पण प्रत्येक महिन्यामध्ये पंचकर्म पण झालेले आहेत व्यवस्थित, विद्धकर्म पण होतं, पण ते कन्सिव्ह नाही करत. याचं काय कारण असू शकतं? म्हणजे यामध्ये अजून काय करू शकतो?
तुझं किती वर्ष झालीत लग्नाला?
लग्नाला 13 वर्ष झालेले आहेत. तेव्हापासून ते कंटिन्यू ट्रीटमेंट काही ना काही चालू आहे, पण आयुर्वेदिकच चालू आहे ट्रीटमेंट. आणि कधी कधी मग तरी म्हटलं प्रोजेस्ट्रॉन वगैरे ते पण सप्लिमेंट देतो, डुफॅस्ट्रॉन वगैरे लास्ट ह्याच्यामध्ये एखाद्या सायकलमध्ये जस्ट पाहण्यासाठी. पण बाकीचं सगळं ओके आहे.
मेल फॅक्टर पण ओके आहे?
नाही, मेल फॅक्टर आधी काउंट खूप कमी होता, पण आता व्यवस्थित झालेला आहे काउंट.
ओके. पण नुसतं माझं म्हणणं काय आहे की तुम्ही त्या मेल फॅक्टर कडे जास्त बघा जरा. समटाइम्स ओनली द काउंट इज इम्प्रूव्ह, बट द मोटिलिटी, विस्कोसिटी हे कमी असतं. कधी कधी टेराटो झूसपर्मी असतो. तर या कारणाने सुद्धा बेबी नाही राहत बरेच. नाही तर मग कार्योटायपिंग करून बघा. कार्योटायपिंग मध्ये डीएनए रिलेटेड जर काही गोष्टी असतील तर ते कधीच कन्सिव्ह होणार नाही. त्यामुळे यू हॅव टू गो फॉर, म्हणजे ह्या गोष्टींकडे पण बघा. फर्टिलिटी प्रोफाईल म्हणजे जी असते ना पॅथॉलॉजीची, त्याच्यामध्ये ह्या गोष्टी पण बघायला लागतात आपल्याला. तिला एकदा पण कन्सेप्शन झालं नाही का?
नाही, एकदा पण नाही.
एकदा पण नाही झालं म्हणजे यू गो फॉर कार्योटायपिंग फर्स्ट. कार्योटायपिंग मध्ये तुम्हाला त्याची उत्तर मिळतील कदाचित.
ओके मॅम, थँक्यू.
Any other questions?
मॅम, एक पेशंट आहे, रिकरंट प्रेग्नन्सी लॉस आहे. First it was 3 months, then it was 5 months, then it was 9 months, and one was after delivery. So what can I do for that?
आफ्टर डिलिव्हरी जे झालं ते कधी झालं? फर्स्ट or सेकंड or थर्ड?
5 days, after 5 days.
नाही तसं नाही. त्याचा तुम्ही क्रम सांगितला ना.
5th डिलिव्हरी.
आता तिचे किती 3-4 तुम्ही उदाहरण सांगितली ना. 3-4 इन्सिडेंट सांगितले. तर फर्स्ट बेबी वॉज 9 months कम्प्लीट, त्याच्यानंतर 5 months असं म्हणजे प्रोग्रेसिव्हली कमी कमी होत गेलंय का?
No, ma'am. First it was less. After the treatment, it increased. But it was stillbirth once, and once it was delivered, but died after 5 days.
Okay. Now, generally, when there is a sequence like this, no, they have to go for the blood group. RH incompatibility nahi na te badana.
Both are having B positive blood group.
And husband?
Both. Husband and wife. B positive.
Okay, B positive.
And torch is positive.
Which the torch मध्ये काय पॉझिटिव्ह आहे त्यांचं?
Cytomegalovirus with and rubella.
अच्छा, पण ते IgG पॉझिटिव्ह असेल ना, IgM नाही ना?
IgG.
पण त्याची ट्रीटमेंट घेतली आहे का त्यांनी?
ओके, या मॅम, सेम मी स्टार्ट केले, टॉर्चनिलनी स्टार्ट केले त्याचं.
नाही तसं नाही. ॲलोपॅथिक ट्रीटमेंट त्यांनी घेतली का?
नाही घेतले मॅम.
मग तुम्ही एक काम करा, तुम्ही त्यांना ना 40 days तो Toxocare म्हणून gold use, pyramidine, 3 ml, 3 milliliter. You will get it in the market. You start
Okay.
it for 40 days, one OD. First, see,
Okay.
even if it is IgG positive, no, we still have to treat the patient. हे खूप
Okay.
कमी लोकांना माहिती असतं. हे आम्हाला पण नंतर नंतरच कळायला लागलं प्रॅक्टिसमध्ये पडल्यावर. किंवा जसजसं आम्ही सिनियर होत गेलो, आमचा अभ्यास वाढत गेला तसं. सुरुवातीला वी ऑल ऑफ अस आर टोल्ड की आयजीजी काही गरज नाही ट्रीट करायची. ओनली आयजीएम इज नेसेसरी. पण तसं नाहीये. इव्हन ॲलोपॅथिक पीपल ट्रीट द आयजीजी ऑल्सो. आणि तेच पॅरामायसिननीच ट्रीट होतं. अजूनही दुसरा ड्रग नाहीये त्याला. So first you treat with that, and then you give whatever Ayurvedic you want. Torch nail, sujat, पंचकर्म, शुद्धी करायची असेल तर वमन, विरेचन आणि बस्ती म्हणजे वासंतिक वमन द्या तिला. किंवा आता शरद ऋतू आता होता तर विरेचन देऊ शकला असतं. व्हॉट एव्हर. मला काय म्हणायचंय, यू ट्रीट हर विथ दॅट टॉक्झोकेअर टॅबलेट अँड फॉर 40 days. बट या 40 days मध्ये टेल हर की यू शुड नॉट कन्सीव. कारण ती कन्सीव्ह झाली तर तिचे ब्लड ह्याच्या चेंजेस होतील, विच वी डोंट वॉन्ट. ठीक आहे. सो यू गिव्ह दिस मेडिसिन टू हर अँड देन ओनली शी विल कन्सीव्ह. आणि सेकंड इज डू अ कार्योटायपिंग टेस्ट.
Okay.
कारण तुमच्या मते ती नाही, ती दुसरी केस होती, राईट. बट स्टील इथे कार्योटायपिंग नको. इथे तुम्ही हेच करा फक्त. तुम्ही आधी तिला टॉर्चची ट्रीटमेंट द्या. आणि बॅड ऑक्सिजिक हिस्ट्रीची एक प्रोफाईल असते मॅडम. टॉर्च 10 प्लस अदर फॅक्टर्स आर ऑल्सो देअर इन दॅट. तर तुम्ही आता तुम्ही कुठे प्रॅक्टिस करता त्याप्रमाणे तुमच्या एरियात जी लॅबोरेटरी आहे ना, जी एकदम ऍडव्हान्स आहे, त्यांच्या ह्याच्यात तुम्ही जा. मेनू असतो त्यांचा, काय काय आमच्याकडे अवेलेबल आहे. आणि त्याच्यामध्ये बीओएच प्रोफाईल वगैरे हे सगळं त्याच्यात असतं. त्याच्यात सगळंच म्हणजे जे आपल्याला काही ऍडव्हान्स पण काही गोष्टी माहीत नसतात डॉक्टरच्या, त्या त्याच्यात कळतात. तर त्या टेस्ट तुम्ही करून घ्या. बट बेसिकली यू ट्रीट हर विथ टॉक्झोकेअर फर्स्ट.
Okay, ma'am. Sure.
तर नेक्स्ट
Thank
3
you.
months कन्सेप्शन नको होऊ दे. आणि ही
Yeah, I
औषध
told you.
चालू असताना 40 days तिला कन्सेप्शन म्हणजे जोपर्यंत गोळी चालू आहे ना, तिला म्हणायचं की दिवस राहू देऊ नकोस.
Okay, ma'am.
ठीक आहे.
Okay, ma'am. Thank you.
थँक्यू.
Any other questions? In chat box.
Yeah, one person asked me how to understand high IMH from Ayurvedic point of view. High AMH is a condition in where multiple follicles are inducing. म्हणजे ती बेसिकली AMH जास्त होतं म्हणजे काय होतं, असं नाही की नैसर्गिकरित्या तिला जास्त असतं. नो. व्हॉट AMH हाय ही विकृती आहे. ही हाय म्हणजे इट कम्स अलॉंग विथ पीसीओडी. त्याचं कारण असं आहे की पीसीओडी मध्ये काय होतं, अर्धवट फुटत जाते ती. साध्या भाषेत सांगायचं, सिंपल लैंग्वेज में अगर देखा जाए तो व्हाट इज पीसीओडी, पॉलिसिस्टिक ओवेरियन डिजीज. तो उसमें क्या होता है कि ओवुलेशन होता ही नहीं है पेशेंट का, लेकिन ओवुलेशन जैसा वातावरण दिखता है. एंड द ब्रेन डजंट नो दैट, द हॉर्मोन्स डोंट नो दैट. तो आप कितने सी सपोज आई विल गिव यू अनदर एग्जांपल. सपोज यू हैव kept some money in the bank and the bank officer has been advised कि ये जितने बार आएगा you note it down and you give him some penalty, something like that. Okay. So he is going to the bank but he is not taking out the money. He is just going to the bank. लेकिन इफेक्ट तो वही आ रहा है ना कि वो बार बार बैंक जा रहा है. So whatever the penalty that person is going to face, that is exactly what is happening in PCOD. कि बार बार वो जस्ट थोड़ा जाता है फिर अर्ली फूटता है. सो देर आर मल्टीपल follicles which are formed and ovulation doesn't take place, but the brain doesn't know that. So what is happening, see, the procedure is noted and according to that there is a surge in the FSH and LH, and that is why the AMH it looks like it is high. जितने बार ओव्यूलेशन होगा उतने बार बीज फूटेगा, बीज फूट गया तो रिजर्वायर कम हो जाएगा, है ना। तो दैट पीसीओडी में जो एज बढ़ता है ना, दैट इज नॉट अ गुड साइन, इट इज विकृति. Okay, as I said before, neither allopathy nor Ayurveda is a miracle. Matter that cannot be created nor it can be destroyed. तो अगर जितना है उतना ही है आपके नसीब में. जितने ओवम, जितना रिजर्वायर आपको भगवान ने दिया है जन्म लेते समय, इट इज नॉट गोइंग टू गो अप और डाउन. इट विल जस्ट इम्प्रूव और इट विल, इट विल बिकम बैड. पण नंबर चेंज नाही होत. आयुर्वेद होऊन ऐसा एलोपॅथी. ठीक है.
Ma'am, can I ask one question, ma'am?
Yeah. This is
Uh,
Mrunal Patil.
I'm uh, I'm Dr. Kavita. I wanted to
Okay.
ask, I get a lot of cases wherein patients are obese and they complain of scanty menses. So,
Yeah.
how do you think, according to our Ayurveda, like there is a avaran? How do you interpret this? Like,
बेसिकली आयुर्वेदामध्ये मेदोरोग जे म्हटलंय ना, या इथे इन अ वे इट इज आवरण ओनली व्हॉट यू आर सेइंग इज राइट. सो ओबेसिटी इज इन टू वेज वी कैन थिंक अबाउट. अगर एलोपैथी से देखा जाए तो यू नो द एडिपोज टिश्यू होता है. सेंट्रल ओबेसिटी में एडिपोज टिश्यू सारा पेट में ही आता है, एंड दैट अफेक्ट्स द हॉर्मोन्स एंड दैट इज व्हाई देयर इज कैंटिलिटी. दिस इज बिकॉज ऑफ एलोपैथी. इन आयुर्वेदा व्हॉट वी कैन थिंक इज अष्टव निंदित सांगितलेले आहेत ना, अष्टव निंदित बोला है ना, अति रस्व अति दीर्घ, है ना. तो उसी में
hmm,
अति स्थूल अति कृश भी उसी में आता है, जिसे मॉर्बिड ओबेसिटी कह सकते हैं. दैट कम्स इन अष्टव निंदित. अगेन मेदो रोग जो बोला है उसमें वो वही लिखा है ना, मेदसा अवृत मार्गत्व. तो हर एक धात्वग्नि जो है ना, जहाँ अग्नि की बात करते थे हम, वहाँ धात्वग्नि भी है. थायराइड में धात्वग्नि कम होता है ऐसा बहुत लोगों का कहना है. तो जो जो धातु जहाँ से उत्पन्न हो रहा है, जैसे रसत रक्तम रक्तत मांसम, जहाँ जहाँ वो उत्पत्ति हो रही वहां अगर उसका मांद्य होता है, यहाँ वहां अगर ऑब्स्ट्रक्शन है, तो आगे का धातु तो यही हो जाएगा, रसव स्वतः विकृत होगा, रक्त वह विकृत होगा. एंड मेदसा अवृत मार्गत्व, तो मेदो रोग का संप्राप्ति में श्लोक ही दिया है ना उन्होंने. तो होता क्या
so,
है, बिकॉज ऑफ द मेद अवृत तत्व, बिकॉज ऑफ दैट मेद का ही पोषण होता रहता है. और बाकी सारे धातु राइट फ्रॉम शुक्र टू रस, उसका ह्रास होने लगता है. अगर रस का ह्रास हो जाए तो रक्त का भी होगा और मेंसेस का भी होगा, क्योंकि रस व स्रोतस का उपधातु वही है ना. उपधातु क्या है, स्तन्य और रजन, है ना. तो रस व स्रोतस कम हो गया तो स्तन्य व स्रोतस एंड रज इज गोइंग टू कम डाउन. दिस इज व्हाई पीसीओडी आल्सो टेक्स प्लेस.
so such such cases, how do we treat, like, um,
इसमें भी
rasa?
लेखन देना है आपको, पहले रसायन देना है. अगर आपको पंचकर्म पूरा का पूरा करना है तो गो फॉर वुमन. बेसिकली कन्विंस हर फॉर वुमन, बिकॉज वुमन विल हेल्प इन पीसीओडी ऑल्सो. अगर उसको पीसीओडी है तो, जैसे कफज विकार में हम वुमन देते हैं, पित्तज विकार में विरेचन देते हैं, और वातज विकार में बस्ती देते हैं. और अभी आजकल क्या होता है कि सब कॉम्बिनेशन के पेशेंट आते हैं. तो ऐसे में यू हैव टू गिव पंचकर्म लाइक बस्ती ऑल्सो, कन्विंस हर फॉर विरेचन और वुमन, गिव हर शोधन द्रव्य लाइक गुड़ एंड ऑल दैट, एंड ऑफ कोर्स शी हैज टू एक्सरसाइज. तो ये सारा मिलके, एंड शतपुष्प हेल्प्स इन दिस ऑल्सो, इन ओबेसिटी ऑल्सो. तो उसका स्कैंटी मेंसेस है एंड उसका ओबीज है, तो स्टार्ट हर ऑन शतपुष्प रेजिम. यू विल गेट रिजल्ट इन 2-3 months if she takes it properly.
Okay, ma'am. And in raised prolactin, even there, rasa dhatu is deranged.
वहाँ नो, या यू कैन से ना, अभी तो मैंने बोला ना, रस का ही वो उपधातु है ना स्तन में.
Yeah, yeah, yeah.
तो इट विल
Oh,
वर्क लाइक दैट. मैं आपको सबको एक सजेशन देती हूँ. आई नो यू मस्ट बी वेरी बिजी इन योर प्रैक्टिस एंड ऑल, लेकिन आपका जो अष्टांग संग्रह है ना, पहले वाला फर्स्ट ईयर को पढ़ा है, वो उसके सूत्र स्थान देखो. इसमें सारे जो सूत्र है ना, वही अहोरात्रि गुप्ता नाम, या ये रस 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 रसात रक्त रक्तात मौसम मौसम मेदम, ये जो 21 दिन का सूत्र है, ये सारे सूत्र अभी आपको प्रैक्टिस में उपयोगी पड़ेगी। आप सब पढ़ना शुरू करो थोड़ा सा, if it is possible for you, because it will help you in your own, you will own invent your own this, आपका फोकस बदल जाएगा। जितना आप पढ़ के पेशेंट ट्रीट करोगे ना, उतना आपको रिजल्ट आएगा अच्छा। डिप्रेशन भी, व्हॉट इज डिप्रेशन? ते रसवसच विकृती होती ना, अश्रद्धा, अरुचि, तंद्रा, है ना। अश्रद्धा मीन्स व्हाट, किसी भी चीज पर से विश्वास उठना, कुछ करने की इच्छा न होना, ऑल दिस इज डिप्रेशन। रसवसच का ही तो है ये। और हमने आजकल वो कम किया है ना, रस बंद किया है हमारे लाइफ से, इसलिए ये सारा प्रॉब्लम लगता है। तो बेसिकली इट कम्स टू लाइफ स्टाइल ओनली अल्टीमेट, है ना।
Okay. Yeah, ma'am.
ठीक है?
Thank you.
या, चलो हो गया।
Yes, ma'am.
Okay. Okay, thank you so
Okay,
much.
thank you.
Just a second, ma'am. Today's session reminded us that infertility management goes far beyond protocols. It requires understanding patients' avastha and their lifestyle, emotional status, and subtle doshic imbalance. So, with the help of ma'am explanation, it helps us to bridge the classical knowledge with practical experience beautifully. So, now in the end, I now request Dr. Ramdas Garje, President of MAASD, to please felicitate our speaker of the day. By presenting the memento.
Okay, thank you, sir.
Thank you, ma'am, for your insightful and informative session during the infertility of CME. We truly appreciate your valuable contribution and pleased to felicitate you and your excellent presentation in this virtual CME. Thank you. Thanks a lot.
Thank you.
Thank you so much, sir, for the platform you have provided today. And ladies and gentlemen, as we come here to the close of today's enlightening CME, I extend my heartfelt gratitude to our respected madam for sharing her vast clinical experience with us through the series of an real-life infertility and PCOS cases, along with commonly encountered reproductive complaints. We were able to understand the depth of Ayurvedic diagnostics and individualized management. So, on behalf of everyone present, I express our deep gratitude to Madam for her time, clarity, and her dedication. And a warm thank you to all participants. You have been a wonderful audience. Also, thank you everyone for the coordinators, Dr. MAASD coordinators, council members, Dr. Sujit Dundle, Dr. Nitin Patil, Dr. Ganesh Vajai, Dr. Seema Mehre ma'am, and CME Organization Council, Dr. Tejas, Dr. Harshal, Dr. Sankalp, and Dr. Archana. You have been a wonderful audience. Thank you so much, ma'am, and thank you so much, audience. You have a wonderful evening ahead, and we do expect, ma'am, to please continue and please bring more cases to us and please enlighten your knowledge with us in the futures
Thank
also.
you.
Thank you so much, ma'am.
Thank you. Thank you so much. Bye.
Thank you so much, ma'am. Thank you everyone for joining.
Thank you.
मॅडम तुमचा व्हॉट्सअप नंबर मिळेल?
हो, घेऊन घेता का?
हा मॅडम सांगा ना प्लीज.
99
हा
309
हा
40403.
40403.
हम्म.
थँक्यू मॅडम. ते मेल फर्टिलिटीचं आणि शतपुष्पा रसायन रेजिमेन
हो,
टच मध्ये राहतो मॅडम या बाबतीत. थँक्यू.
थँक्यू.
Thank you, ma'am.
झाली का मीटिंग? झाली मीटिंग?
Oh, madam.
ओके, थँक्यू.
Thank you, ma'am.
मॅम परत एकदा नंबर सांगाल का प्लीज?
99309
99309
40403.
40403.
Yeah.
Okay, thank you, ma'am.
Okay.